Good morning, everybody.
Morning.
Call the meeting to order for the Appropriations Committee on Friday, April 21st. This is our JF deadline. And we will be coming in. As you see, there is a caucus going on. The Republicans are meeting, I believe, in 2A. And they should be back by 10:30, so you can all go and have a meal or visit the cafeteria, take a walk over to the Capitol. And if you're really interested in a scintillating meeting, Exec Noms is meeting right down the hallway. So we're going to do that. Okay, so we're going to recess. Thanks. Thank you, Vinny. Thanks. I appreciate that. Just so everybody knows, we've been asked for an extension to the caucus that is going on till 11 o'clock.
hold on. Jeez, why isn't this not working? Okay. Oh,
So good morning, everybody. Or actually, I think, is it afternoon yet? Nope, still morning. So we are going to reconvene the Appropriations Committee for Friday, April 21st, 2023. Representative Walker.
Good afternoon, everybody, and this is our last day. Woo-hoo! So I appreciate all the work and everything that everybody's done, and I'm very happy that we are winding down, at least for the formal part of our Appropriations Committee, and I want to thank everybody for all their hard work. So thank you, Madam Chair.
Thank you. Senator Bethel.
Thank you, Madam Chair. Good morning, everyone. I'll just reiterate what I said yesterday. We do have quite a few bills before us today, and a no vote is not necessarily a lack of support for the bill, but perhaps just an opportunity to flag and ask some additional questions going forward. Some of these bills have substantial fiscal notes and may require some additional thought by some of our members today. But with that, thank you, Madam Chair.
Thank you. Representative Nuccio.
Thank you very much. Just wanted to welcome everybody today again, and I will politely ask my house chair, why she's saying this is our last day.
Well, it's officially basically
It's
sort of.
Officially kind of our last day, yes. So I look forward to the bills we're gonna call today and some robust discussion and debate. And let's get the day going.
Madam Administrator, are you all ready for us to start the discussion? Okay, we're going to call first item up for discussion and questions would be item number 2, Senate Bill number 10. An act promoting access to affordable prescription drugs, healthcare coverage, transparency and healthcare costs, home and community-based support for vulnerable persons and rights and regarding gender identity and expression, proposed action JF. Is there a motion?
So moved.
Moved by Representative Walker. Is there a second? Who has the second?
Senator Cushion.
Senator Kushner. Discussions or questions? Representative Hoxa.
Thank you, Madam Chair. This bill is, pretty big. The title itself is really big and kind of touches on many different topics. Something that immediately caught my eye was towards the end, where it deals, at least in the title, it discusses, children and issues relating to gender and, et cetera, et cetera. I would like to know more specifically what that means, where the money would go. Would it go to things like gender affirming care? I'm sure that, we've all, this is a pretty salient, topic on the national level as well. And it's something that's, very concerning, to myself, and I'm sure other members in my caucus, as to specifically where money would go to things like that, and what age ranges of children, of minors, we're talking about minors here, that money would be used to provide this, quote unquote care, so to speak. So if yourself or anyone, maybe the author of the bill, has some clarification as to, how that money is being allocated for such potential treatments. Like I said, the bill is pretty extensive in that regard. And, I'd like just some more clarification on that, through you, Madam Chair. Thank you.
Thank you, Representative Hoxa. Do you have a specific line item that you are referencing?
I do not have a specific line item at this moment. It's the title itself, expresses, that particular thing that I just, referred to. And I want to know I'm asking where in the bill that is, and where and what it essentially means as far as how much money is being spent on that and what that itself is.
So. Representative Nuccio, what line item?
Well, I'm just in the bill I'm looking at. It looks like maybe it starts around 1211.
Okay. So the proponent of the bill is the President of the Senate, and he is not here today. So we will attempt to answer the questions as succinctly as possible. And so what this is referencing to, all medical care relating to the treatment of gender dysphoria as set forth in the most recent edition of the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders and Gender Incongruence as defined in the 11th edition. And it does not have an age reference in here relative to your concern about age. Any other questions, Representative?
Yes. Does it have a cost associated?
There's a cost associated with this bill throughout the bill. And the cost associated this was relative to, but it was actually a minimal cost, and the cost for Senate Bill 10 is incorporated into the budget.
but we don't know what that number is right now.
Off the top of my head, I don't have that right in front of me, but I had all the costs associated with Senate Bill 10 put forth, and we incorporated that into the budget. All the Senate bill priorities were associated with change to the budget.
And Madam Chair, if you'll permit, should the proponent of the bill make himself present at this committee meeting today, would I be permitted to ask another question through you to him as I look over this bill some more?
He is not coming today. I know that.
Okay,
So you're not going to see the Senate president come here for questions by the Appropriations Committee. I make appointments to the Senate bill, Senate president.
oh, I apologize.
I'm
I'm
sorry.
I'm confused. I thought this was not the Senate president's bill, but a different senator's bill.
No, this is the Senate president.
Okay, I apologize for that. That was my yeah,
Senator Lesser is here, but this is the Senate president's bill,
understood.
and we are not providing him for anybody to question.
I see. Okay, at this time, I have no further questions.
Thank you very much. Are
Thank
there
you.
any other questions relative to this bill? Representative Harrison, followed by Representative Chaleski.
Thank you, Madam Chair. I noticed that the federal poverty limit in this bill is increased to 200%. Can you tell me what it was prior to the increase?
I believe 175.
Okay, and why, can you give any explanation of the reason for the increase?
The reason is to cover more people.
And do we have an idea, Madam Chair, how many more people, how many people were covered and now how many more people were covered? will be
I don't have
covered?
that exact number.
Okay, thank you, Madam Chair.
Representative Chaleski, followed by Representative McCarty.
Thank you, Madam Chair. Just to clarify, this is only partially in the budget. My understanding there's section 8 and 13 in the budget, while not included in the budget are sections 2 through 4, 5 through 6, 10, 11, 14, 15, 16. So that's significant amount that is not included in the budget. Am I correct?
My understanding is that that whatever is in this bill will be in the budget by the end of that, or parts of this bill will be removed so that they will not have to be covered.
Okay, I see. And then another question, I know that my understanding is that this bill establishes a working group to seek input on the department guidelines for gender affirming procedures. I believe that Representative Hoxha was speaking about. Can anyone explain who makes up that working group?
All working groups in the General Assembly have representation by all 4 caucuses and experts relative to the issue at hand.
Great. So medical experts, obviously,
Excuse me, I'm sorry.
medical experts included.
Correct.
Yes, thank you very much, Madam Chair.
Thank you. Representative McCarty, followed by Representative Belinsky.
Thank you very much, Madam Chair, and I'm not sure who should address this particular piece, but I'm concerned about the part of the proposal that mentions the 340B plan. And if someone could just give me a concise answer as to how, where the costs, because this piece was in front of Public Health, I believe, and there was a lot of opposition from the Hospital Association and others about that the costs, that it could be very detrimental to the hospitals. And so if someone could just explain a little better to me that section 340 on 340B.
So 340B is another mechanism for us to bring in more dollars from the federal government. And it was not in public health. This was a
No.
human services bill. So I don't believe it was in public health.
Yes, it
That's one of
was.
my questions. I believe 340B is in several bills.
No, but it's not this bill in particular.
SB 10's not, but I
Right.
think 340B.
Oh, I have no
Yeah.
idea.
Yeah, that-
340B. Is
well,
that what you meant? You didn't
yeah.
mean that this bill?
No, I
I'm
meant,
sorry. I
because I-
misunderstood what you were saying.
and that's my only, because I think there are a lot of very good points to this bill and I appreciate it, but because I want to know more about the 340B plan, from what I had heard, I'm going to more than likely be a no today. And I just wanted to put on the record the reason, because there are an awful lot of good pieces to this bill.
Thank you. Any other questions? Representative Belinsky, followed by Representative Dathan. Representative Belinsky.
Thank you, Madam Chair. I hope I'm a little bit more audible today than I was yesterday. I don't have a question. I have a comment. I find this bill to be incongruous. It takes two very, very different subjects and jams them together, particularly in the title of the bill. But I look at this and I know how hungry we are as a state and as a society to drive the prescription drug costs down, because it's a serious problem for everybody. It's terribly unaffordable and it's terribly inequitable. And standing on its own, this is something that it would be worthy of an awful lot of conversation and consideration. But the fact that we want to hide something that, or not hide, but it's in plain sight, but putting the gender dystrophy subject into something that, in my opinion, is a topic that we can all agree that needs work, for something that we can't all agree is a topic that our constituency is going to support, is going to make me a no on this bill. Thank you very much, Madam Chair.
Thank you, Representative Belinsky. Representative Dathan.
Thank you very much, Madam Chair. I just had a couple quick questions because there's about 22 parts to this bill. On the section regarding the 340B provisions, was that in another vehicle in the insurance committee this year?
I have no idea of any other bills other than the one in front of me today.
Okay, because there's some aspects here that are deal with insurance law rather than necessarily Medicaid issues that we heard in the human services. And I do know from being a previous member on the insurance committee that there are several things already in place that OHS does regarding prescription drugs. And I know the governor had a separate bill on this, but my concern is there is a lot of duplication of efforts. And also we are still in the middle of getting a lot of data around the drug pricing. And I know a lot of this data isn't due to come from the feds until September 2024. And so that's, a bit of a concern that we're kind of trying to put the cart in front of the horse with that aspect of the bill. Is there anyone on the insurance committee who's part of this?
You're not going to go through other committees' bills.
Okay,
We are not.
okay,
And I would remind you very directly that this is the Senate President's bill.
yeah, I understand. And I'm going to
Okay.
be voting yes for it. I just wanted
Okay.
to ask those questions. Thank you very much, Madam Chair.
Thank you. Representative Nuccio.
Sorry, I couldn't find my button. Thank you, Madam Chair. So fully understanding whose bill this is, I have, I do have some questions on this, and I will just procedurally, do we expect this bill to actually be referred to insurance at some point because it is a lot of that? Would that procedurally work that way?
I'm not positive if that would go before the insurance committee or not. I'm not on the screening committee for the Senate. And generally, bills that are touch a variety of committees go to at least some of them, but I'm not positive where this bill is going. That all I'm dealing with is the fiscal part of the bill.
Okay. So I just want to align my comments with Representative Dathan in the sense that there's a lot in here that is mainly insurance regulation, which I would hope that it would go through the insurance area. For instance, the anti-tearing, anti-steering, there's at least 3 bills out there right now regarding anti-tearing and steering. And the one that was voted out of the insurance committee was from a work group that happened a significant long period of time that we've been working on these things. And it's also one of the governor's priority bills. And there's a lot of conflict between the language that's in here and these other bills, along with, as Rep. Dathan said, the 340B legislation, which has historically come through insurance. So I guess I'm kind of not sure why the anti-tearing, steering, the 340B and the DOI language is not directly hitting the department rather than coming to appropriations. But in light of it being appropriations, I do have a question regarding what's included and excluded. I know section 13 is included in the budget. I know that, and that's the covered Connecticut up to 200% of the FPL. But section 14 is not, and I just need to get some clarification because it says program cost to the Department of Social Services to the extent the plan is the plan to expand income eligibility up to 300% FPL is approved and implemented. So does this bill, I'm trying to actually get to section 14,
That's
but
where I'm going.
I'm the long book that
The long bill.
it is, I'm at 19, I'm too far, hold on. My goodness gracious. Section 16. 15. 15. Okay, it's on line 705, it starts.
Yep.
So this year, it's basically expanding it out to 300% FPL. There's the good, I like the 30-day piece here, making sure that the payments and such are made in the 30-day part, but it's in the first section, it starts around line 711. The plan shall provide state-assisted healthcare coverage for persons otherwise qualified for the program whose income exceeds 200% of the federal poverty level, but does not exceed 300% of the federal poverty level.
This also says that they will develop a plan in line 710. It does not, and that plan does not necessarily mean that it would be implemented.
Well, I guess I may disagree with you respectfully on that, because it says the plan shall provide state-assisted healthcare coverage. So it's not a may, but a shall.
It also has to be approved by the federal government.
Well,
Which
that's
is
the
in
waiver, right? Like that.
757 to 760, so nothing can be covered until that would happen. If the Joint Standing Committee does not advise the commissioner during the 30-day period, the plan shall be deemed denied. That is on 749 to 752.
How does the Joint Standing Committee, how does that work with the shall provide that's over in? Because that's not, this wasn't saying a Joint Standing Committee. This was saying the Commissioner of Social Services in consultation with the Insurance Commissioner and the Executive Director of OHS.
So it says in line 724, the Commissioner of Social Services shall submit the plan developed in accordance with this section to the Joint Standing Committees of the General Assembly, having cognizance of matters relating to appropriations and the budgets of the state agencies, human services, and insurances. Not later than 30 days after the date of their receipt of such a plan, the Joint Standing Committee shall hold a public hearing. At the conclusion of a public hearing held in accordance with the provisions of this section, the Joint Standing Committee shall advise the Commissioner of their approval, denial, or modifications, if any, of the Commissioner's plan. If the Joint Standing Committee,
Is that us? by
this
the
is
way?
us, this is us,
We're
you
the
and I,
Joint Standing Committee, okay.
all of us right here
Okay,
are gonna be on there to hear it, and we're all gonna make a decision on whether we're gonna do anything or not. If the Joint Standing Committees advise the Commissioner of their denial, if such committees do not concur, the committee chairperson shall appoint a committee of conference, which shall be composed of 3 members of each Joint Standing Committee. At least one member appointed from each joint standing committee shall be a member of the minority party. The report of the committee of conference shall be made to each joint standing committee, which shall vote to accept or reject the report. So there's many opportunities to reject the report here.
Okay, if I'm reading this correctly, though, it's saying that this is effective from passage and this has to be done within 60 days.
The plan does,
The plan does, right? And then the
not
plan,
not the actual implementation.
but the plan is no later than 30 days. No later than 30 days after the date of the receipt of the plan. So if from passage, 60 days, we have to have the plan.
Right.
And 30 days after having the plan. So that's 90 days from whenever this is passed and signed by the governor. If we're lucky, would be June, which means June, July, August. So by August, we would have to.
I'm just
we would have
hoping
to-
nobody takes a summer vacation.
Well, I was just gonna say, I love y'all, but I'm going away. But besides that, my concern is that within 90 days of the end of session, we have to raise the FPL up to 300%.
If the plan is approved. Plan has to be approved. This is the plan startup. This is all of us coming together and saying whether we like the plan after they have a public hearing, because they have to have a public hearing on it too. And a public hearing is usually 60 days out.
How do those dates work, though, if we're bound in here by the 30, 60, 30?
Have you ever seen us to comply with getting a working group up? We have a working group that we're trying to get up to do the tobacco trust fund, and that's to spend $12 million. And we haven't gotten it up, and we put that in 2 years ago.
I understand, and I get just as frustrated as you that we don't do that. So I guess, why are we so stringent in the language here? Like it's,
Well-
that's, it's, we're on a 90-day clock. But more importantly, I don't remember if we had numbers between 200 and 300% FPL, what the difference would be that we would have to add to a budget that will already be established.
So I'm sure that, like any other bill, this will change before the end of that time, and we'll take under consideration your comments.
I appreciate that. I really do. I appreciate that. I think that there's definitely work to be done in here, especially along that tract. Also, let's see. There is a piece in here that I just want to make sure there's no financial impact on. It's actually a piece that one of my constituents brought to me, and I'm happy to see that it fell into this bill here. But it was regarding issuing new birth certificates to reflect legally changed name of parents. Is there any cost in here to that from the state, or is that cost going to be assumed by the person changing their name on the birth certificate?
I don't think it's a cost to the state. Most birth certificates are filed with the respective municipality. And it may cost them a few pennies, but everybody has to pay for a birth certificate, and that would be something that's decided at a municipal level.
Okay, so it's not something that's going to be a state expense. It would be on the person, the individual person.
Depending on what each municipality
right.
says, because they may not charge the person.
Okay. Then there is, hold on one second. Is there any cost regarding the RX company, the RX portion of this bill that's in the budget? I don't necessarily see it mentioned in the fiscal notes that we have. I see the staffing person for OSC and the 200% FPL, but I don't know if there's anything in here, maybe, I don't know if OFA, I think it's in section, so a lot of references to like the prescription drug piece of this. I don't know if it's got its specific section, if that was considered, if there was a cost of it incorporating the prescription board well, see, again, I'm sorry, that's an insurance bill, but that kind of passes over with this. Is there any expense related to the RX portions of this that the state is going to have to incur?
Neil?
As he's looking, he's going through this thing. Sorry, Neil, I should have given you a heads up.
Good morning. Do you have specific sections?
Well, that's what I'm looking at. I think it's mainly the first part of the bill, the outpatient prescription drugs. subdivision, the annual outpatient prescription drugs, the preliminary listings and all of that. Like, is this part of, I think we're tracking the drug costs in the all payer claim database. This looks like it's expanding that. And it's accounting for all the lists of drugs and such that have to be shared. Is there any cost associated with, for instance, number 3, the wholesale acquisition costs, less all rebates paid to the state for drugs during the immediate preceding calendar, et cetera? There's just a lot in here around the prescription stuff. I didn't know if we were going to incur additional costs for these programs.
Our folks identified a potential out year cost for the insurance department for potential staffing for sections 2 through 4, as well as a cost to the state comptroller for an additional staff member related to section 8.
So DOI, comptroller, attorney general, but we don't have any ideas on what those costs will be. Is it just staffing?
I think just staffing.
Just staffing? Okay. Thank you very much, Neil. I appreciate that. And I think
That's it?
I think so. I might circle back, but I think so, yes.
All right. You're all set, Representative?
Yes.
Representative Dillon?
Thank you, Madam Chair. Speaking on behalf of the bill, I'm a little confused by the conversation, but it had been my understanding that 340B could simple. Yes,
Representative Dillon, I can't hear you. I'm sorry.
thank you. And I'm speaking in support of the bill, Madam Chair. It had been my understanding that the 340B section would generate significant savings to a number of the providers in the state, and especially, and so I think it's very good. The second is the gender affirming work group. There were a number of young people who grew up in our area that, you know, I assume that they're having a tough time listening to the national conversation, and any problems here, I know Senator Linney will work out, but I appreciate your putting this on the agenda. Thank you very much.
Thank you. Is there any other comments? Senator Berthel? I've been saying this name wrong. I thought it was Berthel, and it's Berthel. No A, E.
Well, thank you, Madam Chair.
There you go, sir.
I've been called a lot of things, but I appreciate the courtesy there. So, Madam President, there's a lot of important things that are covered in a lot of important issues that are covered in this bill. And, you know, I think there are pieces of it that some of us feel we could easily support, and pieces that we don't like. And I guess that's true of a lot of legislation that comes before us. I do have a concern about one section that actually does not relate to the delivery of care, if you will, in this bill. I'd just like to ask some questions of you, if I may.
Sure.
Section 27 of the bill, beginning at around line 949. Does this bill require the Commissioner of Revenue Services to provide income tax data to the exchange?
Say it again now.
So again, section 27, I'm asking as to whether or not this bill requires the Commissioner of Revenue Services to provide income tax data to beneficiaries to the exchange.
Only if the Commissioner of Revenue Services deems such return or return information to be relevant to the targeted outreach to uninsured residents.
Okay, so I guess my next question would be is why I see targeted research. So is that why this information is being shared, Madam Chair?
That's my understanding.
Okay, is the exchange a government agency?
I'm sorry. I didn't understand your
It
question.
is the exchange, that the exchange will be managing the delivery of some of the benefits or all the benefits under this bill.
I don't know that that's been determined.
Okay, my understanding is that the exchange is not a government agency. It's a quasi-government agency. It acts more like a insurance company. And I guess my question and my concern, Madam Chair, is that income tax information is considered confidential under both state and federal law. And the bill goes on to prescribe some changes to that would be authorized should this bill pass. Some changes that would authorize the Commissioner of Revenue Services to provide a box where someone would authorize the sharing of their information. I don't know if that's actually providing consent. And I'm concerned that I'm concerned that we're opening up a door that we shouldn't be opening up. Regardless of someone's financial status, I don't know that the Department of Revenue Services should be sharing confidential income tax information with any other agency. Even if we change the form to allow for consent by the taxpayer to do that. And, there are a whole bunch of other concerns that come out of that in terms of, how, just because there's a change to the tax form, how informed, what effort will be undertaken by the Department of Revenue Services to ensure that, when we get tax forms in front of us, whether we're online or paper or however they're filed, you check boxes, you fill things in, and, are we going to ensure, if this change should happen, that people understand the consent that they may be giving to the department, to the commissioner, to share their tax information? And then, Madam Chair, the other thing that I'm concerned about, nothing against the people that are managing the exchange, but there's a provision in here that says there's a memorandum of understanding that will take place between the Department of Revenue Services, the commissioner, and the exchange that will define how this information is shared with other constituencies, if you will, of the exchange, meaning marketing companies, I believe, if this is an outreach attempt to, provide outreach to make sure that, I guess, people who might be eligible for services are aware that they're eligible for those services. And again, using their confidential income tax information to get to that point. But the memorandum of understanding is not detailed, the detail for that is not provided here, except to say, I believe around, I don't know, somewhere, there's a $5,000 penalty if someone violates the provisions of the memorandum of understanding at line 966. But we don't have the rest of the memorandum of understanding, but we prescribe that if someone violates the memorandum of understanding, they could be subject to a $5,000 penalty. Madam Chair, I don't think it's unreasonable.
What's that? But yeah,
Overreach of government to be authorizing the Department of Revenue Services and our fine commissioner to change a tax form so that your information, even if you consent and check the box without being informed of what you're consenting to, is used to then market you. So to that end, I have a friendly amendment that I would like to offer on this bill, and the clerks have copies of that amendment if they would distribute. Sorry? The first one, yes. Regarding sections lines 949 through 976. So Madam Clerk, if you allow the clerks to distribute the copies of that.
If
I
they're doing it
appreciate
right
that.
now.
They're doing it. Thank you.
Okay, just to be clear, we understand that you call it a friendly amendment. Friendly amendments are when they're signed off by both parties, and the majority party is not signed off on the memo.
Okay, well, maybe it'll become a friendly amendment then.
No, it's not going to.
All right, well,
I appreciate wishful thinking. I thought we could go on consent with all the items on the agenda, so
Well,
that didn't happen
yesterday we
either.
had quite a few. We
I
made
know.
some great
So you
progress.
have an amendment on the floor. Is there a second for this amendment on the floor?
Oh, I'll second that amendment. Sorry. I was being
Uh, Do you seek leave to summarize this amendment, sir?
Yes, very briefly, Madam Chair, this amendment seeks to strike lines 949 through 976 in their entirety, and then to do all of the stuff that needs to be done in terms of renumbering. That would essentially remove the authorization of that would be provided under this bill to allow the Commissioner of Revenue Services to release confidential income tax information to the exchange for the purpose of marketing. Thank you, Madam Chair.
Okay, this is LCO number 5227.
Thank you.
Is there any further discussion on the amendment? Representative Nuccio?
Thank you, Madam Chair. I would actually, I think this is, it may not be friendly, but I think it's a really good amendment. If we look at, I have some concerns in here. First of all, the days of the ACA, which required every person to have health insurance, that mandate was removed at a federal level. You are no longer required to have insurance or face a penalty if you don't. I do have some concern around the words targeted outreach to uninsured residents. How are we establishing that? If I have insurance through my private provider, how is the state validating my insurance? That's a little too big brothery for me to figure out how they're gonna figure out that I have insurance, how they're gonna figure out that I don't have insurance, and then what exactly does a targeted outreach to uninsured residents mean? I'm a little concerned that this is a mandated change on the tax forms, and it doesn't even say that it's going to use that information. It says if the Consumer of Revenue Services deems such return or return information to be relevant to targeted outreach, that commissioner may disclose that the personal income tax information to the exchange. And the exchange is not, it is a quasi government because it's selling plans on the exchange, which are from private insurers. That's how they're paid. We have a couple people who provide plans on the insurance, on the Access Connecticut CT thing. So this doesn't even give you an opt-in or opt-out option. That's a little concerning when it comes to somebody having access to my tax information and sending it to another organization that is running insurance plans and then not giving me the ability to opt out. And I'm just really concerned with how they're going to figure out whether somebody is insured or not without really violating your privacy to find out if you or your husband owns the insurance policy or pays for the insurance policy for your whole family. So I didn't understand 100% Senator Berthel's amendment until we got into this conversation. And as somebody who's in the insurance industry, I think this is very concerning. Thank you.
So as in any other bill, it's a work in progress, and we're going to address many of the concerns that you're talking about. Are there any other comments? No, Senator Berthel, do you have?
Could we do a roll call vote on this?
Yes,
please?
we're going to do a roll call vote.
Thank you, Madam Chair.
And I'm going to encourage people to vote against this amendment. Thank you very much, Madam Administrator. If you called the roll, please.
Senator Austin,
Senator Austin votes no.
Representative Walker. Senator Hartley,
Senator Hartley, no.
Representative Exum,
Representative Exum votes no.
Representative Paris, Senator Berthel,
Berthel, yes.
Representative Nuccio,
Nuccio's yes.
Senator Anwar,
Senator Anwar, no.
Representative Baker,
Representative Baker votes yes. Representative Baker votes yes.
Representative Belinsky,
Alinsky votes yes.
Representative Callahan, Representative Candelaria, Representative Chilesky,
Representative Chilesky votes yes.
Representative Curry, Representative Dathan,
Representative Dathan is a no.
Representative DiCaprio. Representative Delaney.
Representative Delaney votes no.
Representative Delnicki.
Yes.
Representative Dillon.
no,
Representative Felipe.
Representative Felipe votes no.
Senator Flexer. Representative Foncello.
Representative Foncello votes yes.
Representative Garabay.
Representative Garabay votes no.
Representative Gibson.
Representative Gibson votes no.
Representative Gilchrist.
Representative Gilchrist votes no.
Senator Gordon. Representative Gonzalez.
Representative Gonzalez vote no.
Representative Haddad.
Haddad votes no.
Representative Hall.
Representative Hall votes no.
One more time for me, please.
Representative Hall votes no.
Thank you, sir. Representative Harrison.
Yes.
Representative Hoxa.
Representative Hoxa votes yes.
Representative Johnson.
Representative Johnson votes no.
Representative Khanna.
Representative Khanna votes no.
Representative Kennedy.
Kennedy votes yes.
Senator Kushner.
Senator Kushner votes no.
Senator Lesser.
Senator Lesser votes no.
Senator Marks.
Senator Marks votes no.
Representative McCarty.
Representative McCarty votes yes.
Senator McCrory.
Corey votes no.
Representative Nolan. Representative Porter. Representative Osborne.
Osborne votes no.
Representative Reyes. Representative Rosario.
Representative Rosario votes no.
Representative Rutigliano.
Yes.
Representative Ryan.
Ryan votes yes. No.
Representative Sanchez. Senator Slapp.
Senator Slab votes no.
Representative Sims.
Representative Sims votes no.
Senator Summers. Representative Tersiak.
No.
Senator Winfield. Representative Zawistowski. Are there any members? Oh, Representative Callahan?
Madam Administrator. Madam Administrator,
Yes, Representative Baker.
Representative Baker would like to vote, change his vote to no.
Got it. Thank you, sir. Representative Callahan?
Thank you.
I would like to record a yes vote.
Thank you, sir. Are there any other members of the committee who have not yet cast a vote who would like to do so at this time?
This is Senator Gordon, if I can vote.
Absolutely. How would you like to vote, sir?
Senator Gordon votes yes.
Thank you, sir.
Madam Administrator, are you all set? What is the tally, ma'am?
Total number voting 43, those voting yea 13, those voting nay 30, those abstaining 0, those absent not voting 10.
The amendment fails. Continue now. Are there any other comments on Senate Bill 10? Representative McCarty.
Thank you very much, Madam Chair. And if I may, I understand the amendment just failed, but you did state that you would continue to take into consideration some of the comments that are being made today as the work may continue on the bill. And if I may just point out, on line 945, that the commissioner will be allowed to, with the memorandum of understanding, disclose information to a third party. Would you take into consideration that that should also take into account the individual's permission to do so?
Correct.
It doesn't say that, and I'm
Yep.
just asking.
We will.
Thank you.
All set. Senator Hartley.
Thank you, Madam Chair. And I appreciate the discussion on SB 10 and also the body of work that's presented to us here as it has come through various committees. I also have noted that this is a work in progress. I am concerned about the effects on the bio industry that we are continuing to try to scale and seed here in Connecticut with regard to jobs and research. And so with regard to that, I would just like to indicate that I will be supporting this, but I am hopeful that we can continue to refine it and to work on some of the details, most concernedly also ensuring that there would not be, for example, an interstate commerce clause conflict here. So I will vote to move it along, to continue this work, hopefully to address some of these points. Thank you, Madam Chair.
Thank you. Are there any other comments? Representative Kennedy, followed by Representative Harrison.
Thank you, Madam Chair. This bill, realizing it's the president's bill, and looking at it, it appears sections 8 through 13 are included in this budget. But there's potential for some out year costs. Just wanted to just state that. I just have a couple of questions and then followed by a comment on this one. If you could just make, I want to make sure I read this right and understand it. The bill removes, I think it's in section 19, removes the $250 filing fee to change someone's name through the probate court. Could you just explain if there's any fiscal through you impact? Oh, I'm sorry. It is.
You could tell me what line you're on.
Yes. What's that? Yeah, Roman numerals. I hate Roman numerals. XB9, 19, 10, 15, 16, sorry.
60.
Yeah, it's further down. No, it's further down than that. Sorry. It's in the 900s of the.
900?
Yeah.
900.
I believe that the ranking member from the House asked similar questions regarding name changes, and I was just wondering what the impact of the filing fee being removed from the bill.
It will save people money.
Does it impact the state at all?
I'm sorry, what did you say?
Does it impact the state budget in any way? Sorry.
For $250? No.
Okay, times whomever. Okay. All right, I'll move on. Other comments have been made, and I do have concerns about our biopharmaceutical industry. I just want to state that for that. And then my biggest concern is patient care. And I'm wondering if this bill could penalize those who work to improve patient care. So my example would be that, well, first, oh God, go back to my line number here, sorry.
Text him and see if he's okay. I'm sorry, I
There's
didn't
an
hear what the
establishment
question
of a
is.
prescription drug evaluation committee.
Can you tell me what
Yep,
page?
yep, hold on. It's
What page and what number we're on?
Page 9, line item number 2, starts at section 7, starts at line 232. This bill establishes a prescription drug payment evaluation committee to recommend upper payment limits on not fewer than 8 prescription drugs. Blah, blah, blah. Would you know what those 8 prescription drugs, how will those drugs be determined?
No,
for you, Madam Chair? Okay. I had to ask.
I appreciate the ask.
Thank you. And then also, my other concern was, and I don't know the line on them, but the bill requires the establishment, unless it was removed, but I don't see it in here, of a prescription drug discount card program. Is that through 340B or is that something new that's being established through this piece of legislature?
My understanding, it's something new
Okay.
to save consumers money.
Okay. So I do question whether it actually does. And so going to what I was saying before, I do concern myself when, when someone has a doctor's appointment and they go to the physician, they're diagnosed with diabetes, thyroid, whatever the case may be. Sometimes it takes more than one visit, 2 visits, whatever, to get the proper drug correct for that person. So they may be first given one drug and it doesn't work, it doesn't react with them well. So sometimes your physician may give you a sample. It feels like, and correct me if I'm wrong, if I'm reading this correctly, is this being removed by this bill? If your pharmacist wanted to give you a sample to see how it worked to get you started on your program?
This does not interfere with any physician's
No, I'm
initial
not saying,
conversation with the patients,
Okay.
nor their initial work with them
Okay,
relative to the initial.
all right, so let me state it this way. I guess my concern is by going on this drug card program. I know you're saying it's going to save money, but sometimes my concern is that in the long run, it could actually end up costing money. That's just my concern. But
I'm sorry, Representative Kennedy, I didn't hear that last.
I just, my concern would be that in the end run, it could actually end up costing, because if you're filling prescriptions and you're paying whatever your rate is out of pocket and that, and you're constantly changing a medication to get to the right one to serve whatever, if it's a diabetes condition or whatever the case may be, that you could be out of pocket expenses. I just have concerns with the drug prescription card and a lot of and the other one was how the 8 prescriptions would be determined, because those could be drugs that people need, and I'm not sure how those are going to be determined. So I guess we'll figure that out later if we're going to still be working on this. I support a lot of parts of this bill, but for today, I'm going to be a no, because there's a number of things I just still have questions on. So I thank you for that. And we can move on.
Thank you. Representative Harrison for the second time.
Thank you, Madam Chair. As I continue to review and look at this bill, on line 541, it talks about the insurance commissioner making regulations or can adopt regulations. Do we know if those regulations would need to go through the process that we have here, which means a public hearing, the Regulations and Review Committee, or because it says, or implement the provisions, or is the commissioner solely able to make the regulations and adopt them?
So we have what you're referring to is the Regulations Review Committee.
Correct.
And this is the second part. This public hearing for this bill happened earlier. And so we don't have to go through another public hearing relative to this process. So that would be where we are today relative to
So
this.
I think, yes, you're correct about this bill, but I'm saying if the insurance commissioner is making additional regulations, would they, have to go through that process as he feels necessary related to things within this bill?
Okay, I didn't mean to interrupt you, but every single bill we have has updating regulations that they do not return to this committee relative to that. But again, this is a work in progress, and so all of that will be ironed out before it comes up for final vote.
Thank you for that. I have another question, and that is in reading some of, what follows after line 41, it talks about home health care. And what's the difference between the home health care that's in this bill and the money follows the person?
And is that subsection 3? The executive director shall not list any outpatient. What line item are you looking at?
I think it continues right after that where the Department of Social Services shall determine the rates to be paid to the home health agencies, and it goes on to talk about the various people. So I'm just clarifying.
Again, I don't see that right here. So I'm looking at what line item did you say?
Sorry.
$590. So I'm looking on line 40.
Yeah, no. And then I move on to line 587. And it talks about a certified community health worker. Do we know, for purposes of this, what a community health care worker is and what their qualifications are?
I'm a little concerned that we're pulling out one sentence when you really have to take things in its entirety, because one sentence always depends on the previous sentence and the sentence after that. But the commissioner shall include in the fee structure not less than 2 licensed clinical social workers visits to each individual enrolled in the Connecticut home care program for the elderly or any home and community-based Medicaid waiver administered by the Department of Social Services. And this section is the parts that you're referring to are current law. You're referring to current law. 587 is current law. The only section that we're talking about in this bill is 572 to 576. That is enhancing current law. Because if you look on section 10, subsection A of section 17B, that is, there's only a change here, right? So it's not
Correct.
underlined, so it's not, that's current law.
Okay, thank you for that.
All right?
Thank you.
Is there any other comments or questions? Senator Berthel? Representative Retigliano?
Thank you, Madam Chair. I just had a quick follow-up to the good representative's questions. I believe she was asking whether or not when the insurance commissioner issues the new regulations, whether or not they have to go through the regulation review committee. The process where it's reviewed by the Attorney General, has an open public comment period, and then discussed, contemplated by the committee and either passed or failed. I think that might have been the question.
Most regulations come before us, but not all.
Not, so the insurance commissioners wouldn't come before us?
I'm not saying that. I said most regulations come before us, but not all.
Thank you, madam. Thank you.
Representative Berthel for the
Thank you.
second time.
Thank you, Madam Chair. I appreciate the opportunity to speak again. A few moments ago, earlier Representative Kennedy spoke to the $250 filing fee. And very briefly, I would like to offer what should be a friendly amendment, but is not yet. A very, very small change to the wording here. The clerks will pass out the amendment. This is LCO 5227. I would seek leave to summarize, Madam Chair.
So, thank you, Representative Berthel.
Representative.
Sorry, Senator, I don't know. The fact is that you and I both made the same error. The LCO is the budget. And so
Oh.
this isn't the LCO number of the amendment. So I
Thank
just
you.
want to make sure everybody's clear on that.
Thank you, Madam
I
Chair.
said that earlier. You just said it. So I want to correct for both of us
Great, thank you.
that the LCO number mentioned is the bill, not the amendment. Go ahead, sir.
Thank you, Madam Chair, and thank you for the correction. So essentially, this would, at line 1258, would strike some language and insert at line 1375 that any individual age 65 or over shall be exempt from any filing fee imposed under subsection B of the aforementioned section. And I think that's a nice way for us to be friendly to our seniors who are possibly being taken care of through the other provisions of this bill to relieve them from some of the small amount of financial burden. And I would urge adoption. Thank you, Madam Chair.
Is there a second for this amendment?
Second.
It's been seconded by Representative Nuccio. Do you have any comments relative to this? Seeing no comments, I would urge that my colleagues that we vote no. We always want to take care of our seniors and have passed many different pieces of legislation to help our seniors. Not the least of which was supporting $10 million for every senior that helped to support every senior center across this in the last biennium budget. So we are going to take another roll call vote on the second amendment by Senator Berthel and Madam Administrator, and I would urge my colleagues to vote no.
Senator Austin,
No.
Representative Walker. Senator Hartley,
Senator Hartley, no.
Representative Exum,
Representative Exum votes no.
Representative Paris, Senator.
Representative Paris votes no.
Thank you, sir. Senator Berthel,
Senator Berthel votes yes.
Representative Nuccio,
Rep. Nuccio votes yes.
Senator Anwar,
Senator Anwar votes no.
Representative Baker,
Representative Baker votes no.
Representative Belinsky,
Alinsky votes yes.
Representative Callahan, Representative Candelaria, Representative Chaleski,
Representative Chaleski votes yes.
Representative Curry, Representative Dathan,
Representative Dathan is a no.
Representative DiCaprio, Representative Delaney, Representative Dillon, Representative Felipe,
Representative Felipe votes no.
Senator Flexer, Representative Fonsello,
Representative Fonsello votes yes.
Representative Garabay, Representative Gibson,
Representative Gibson votes no.
Representative Gilchrist,
Representative Gilchrist votes no.
Senator Gordon,
Senator Gordon votes yes.
Representative Gonzalez, Representative Haddad,
Haddad votes no.
I'm sorry.
Representative Gonzalez.
Representative Gonzalez vote no.
Thank you, ma'am.
Thank you.
Representative Hall,
Representative Hall votes no.
Representative Harrison,
Representative Harrison votes yes.
Representative Hoxa,
Representative Hoxa votes yes.
Representative Johnson,
Representative Johnson votes no.
Representative Khanna,
Representative Khanna votes no.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner,
Kushner votes no.
Senator Lesser,
Lesser no.
Senator Marks,
Marks, no.
Representative McCarty,
Representative McCarty votes yes.
Senator McCrory,
Senator McCoy votes no.
Representative Nolan, Representative Porter, Representative Osborne,
Representative Osborne votes no.
Representative Reyes, Representative Rosario,
Representative Rosario votes no.
Representative Rutigliano,
Yes.
Representative Ryan,
Representative Ryan votes no.
Representative Sanchez, Senator Slapp,
Senator Slapp votes no.
Representative Sims,
Representative Sims votes no.
Senator Summers, Representative Terciak,
No.
Senator Winfield,
Winfield.
Representative Zawistowski. Are there any members of the committee who have not yet cast a vote?
Yes, madam.
Okay. So I'm going with Representative Delnicki.
Yes.
Thank you. Representative Dillon,
No.
Representative Garabay.
Representative Garabay, no.
Are there any other members of the committee who have not yet cast their vote who would like to do so at this time?
Madam Administrator, if you could let me know the tally.
Total number voting 42, those voting yea 12, those voting nay 30, those abstaining 0, those absent not voting 11.
The amendment fails. Is there any other comments on SB 10? Seeing none, Madam Administrator, if you could call the roll on SB 10.
Senator Austin,
Senator Austin votes in the affirmative.
Representative Walker,
Representative Walker votes yes.
Senator Hartley, Senator Hartley, Representative Exum,
Representative Exum votes yes.
Representative Harris,
Representative Paris votes yes.
Senator Berthel,
Senator Berthel votes no.
Representative Nuccio,
Holy moly, there's a name in there. Rep Nuccio votes no.
you were like me there for a moment. Senator Anwar, Representative Baker,
Representative Baker votes yes.
Representative Belinsky.
Alinsky is a no.
I actually need to see you, sir. Great picture, but I need to see you.
Oh, I'm sorry.
Okay. Here you are.
I'm here. Alinsky votes no. Thank you very much.
Representative Callahan. Representative Candelaria, Representative Chaleski,
Representative Chaleski votes no.
Representative Curry. Representative Dathan.
Representative Dathan votes yes.
Representative Dathan, I need to actually see you and not your photo, please.
Oh, sorry, I was trying to do the safe driving mode. Representative Dathan votes yes.
Thank you, ma'am. Representative DiCaprio. Representative Delaney. Representative Delnicki.
No.
Representative Dillon.
Yes.
Representative Felipe.
Representative Felipe votes yes.
Senator Flexer. Representative Fonsello.
Representative Fonsello votes no.
Representative Garabay.
Garabay votes yes.
Representative Gibson.
Representative Gibson votes yes.
Representative Gilchrist.
Representative Gilchrist votes yes.
Senator Gordon.
Senator Gordon votes no.
Representative Gonzalez.
Representative Gonzalez vote yes.
Representative Haddad.
Haddad votes yes.
Representative Hall. Representative Harrison,
Representative Harrison votes no.
Representative Hoxa,
Representative Hoxa votes no.
Representative Johnson,
Representative Johnson votes yes.
Representative Khanna,
Representative Khanna votes yes.
Representative Kennedy,
Kennedy votes no.
Senator Kushner,
Kushner votes yes.
Senator Lesser. Senator Marks,
Marks votes yes.
Representative McCarty,
Representative McCarty votes no.
Senator McCrory,
McCoy is a yes.
Representative Nolan, Representative Porter, Representative Osborne, Representative Reyes, Representative Rosario,
Representative Rosario in the affirmative.
Representative Rutigliano,
No.
Representative Ryan,
Representative Ryan votes yes.
Representative Sanchez, Senator Slapp,
Senator Slapp votes yes.
Representative Sims, Senator Summers, Representative Terciak,
Thank you, yes.
Senator Winfield, Representative Zawistowski,
Senator Anwar votes yes. Sorry, Madam.
thank you, sir. Madam Chair, are we holding votes open?
We'll be leaving the votes open until 3:30.
Thank you, Madam Chair.
Up next is item number 1, House Bill number 6902, an act concerning Youth Service Bureau and establishment of a juvenile diversionary program. I'll entertain a motion for this bill.
So moved.
Moved by Representative Walker. Is there a second?
Second.
Seconded by Representative Exum. Discussion. Representative Walker.
Thank you, Madam Chair. Madam Chair, the bill before us is not a completed product. I will say that the funding for the program that we are trying to complete is in the budget as we speak. It's on page 206 in the Department of Children and Families budget. What will be changed in this bill is the fact that we are taking out the youth service bureaus and putting in juvenile review boards. We felt that as we were going through and making some of the adjustments that we feel need to happen in order to provide a diversionary program for the Department of Children and Families and for the Court Supported Services Division, we needed to start with the entities called the juvenile review boards and use the same process, but just not interfere with the youth service bureaus because there are so many. And we did not have the opportunity to really talk with all of the different municipalities that had them. So what we want to do is start with a smaller number, design it, develop it, and then incorporate the youth service bureaus that are attached to the ones that we will be working with. Thank you, Madam Chair.
Thank you. Are there any other comments or questions? Representative Nuccio.
Yeah, I just button, grab the button. Thank you, Madam Chair. I was hoping you could just talk to a little bit the concern that was raised on my side here is the potential cost to municipalities associated with the implementation and performance. I was wondering if you could kind of go over a little bit of what those are. I know you said it's a work in process. And I just want to kind of get some information on that.
Sure. What we found was that many districts had youth service bureaus, but they were not all the same. The amount of change that had to be developed is really going to be more than a year or two because of the fact that they are so different. The juvenile review boards are somewhat the same foundation. So the municipalities have had a matching response that they have, a funding matching response that they have to have in order to be a member of a youth service bureau. The juvenile review boards are more independent. Therefore, we will be working more with them, and they are The ones that we will be working with are the major cities, and that's populations of 90,000 or more. So that'll be about 3 juvenile review boards that we will be working with. It will not be touching all of the other cities in the state.
Representative Nuccio.
Thank you for that. So I think that that kind of helps narrow it down. So if there is any kind of municipal impact, and I agree with you, I think the conversation that you and I had is not all of these boards perform the same way and are as robust. So I do think that it's good that we're looking at that and trying to make sure that we have more of a standard process and a standard plan. Because, you know, a kid getting in trouble in New Haven is still a kid getting in trouble in Tallinn is, you know, they're still in trouble, and we need to kind of have the processes there. So I'm going to be supporting this bill today. I just wanted to make sure that I am not looking at an unfunded mandate for my towns. So I think you kind of addressed that it's going to be more focused in certain areas. So I appreciate that clarification there.
Madam Chair. may I go?
Representative Walker.
Thank you. Thank you. And thank you, Representative Nuccio. The whole point is not to put people in a tailspin. The point is to work with them and try and develop a more diversionary program, which we feel is the most important part of the youth service bureaus. But many of them do a lot of different things that are really well needed in their towns. And many of them have some programs that are the same, and we need to have a method of trying to incorporate so that at least when we collect data, we have the same information that we're getting from each one of them. It doesn't mean that they're going to provide every one of the same services. It's just that the generic data will help us to start to identify what are the types of youth service bureaus and what are the types that will be connected to juvenile review boards that are going to go in the future.
I appreciate that. The only other question that I would have in that is something I've brought up here quite a few times is, you know, I've had people talk about lack of compliance. Is this going to be looking at and putting in kind of any structure to whether it's incentivizing or helping or documenting? Because right now, everything that I have is anecdotal, right? I don't have the data that shows how many people are not compliant. So is this going to, can we make sure that it incorporates some form of measure that we can capture to see how bad that problem is, and then how we can address that going forward? Because that's a concern. If we're spending the money and putting all these programs in place and we're not having people comply with it, you know, there's got to be something that we can do to tweak the formula to make it more effective.
Through you, Madam Chair.
Yes, Representative Walker.
Through you, Madam Chair. I thoroughly agree with you. I think you and I have talked about this, and we're going to use results-based accountability in the evaluation because we are talking about contracting with providers in the area, making sure that we are all walking in the same direction, making sure that once we fund something that the end results are the things that we feel are going to be measurable to show whether or not we've accomplished what we need. We had a report that came to the Juvenile Justice Policy Operation Committee that talked about the youth service bureaus, but we realized that it did not give us the content that we really needed. So we're going to have to work our way down. So we decided to start with size first. So that's why we started with cities of 90,000 or more. Hopefully we'll have a prototype of what we're going to be doing and how we're going to be gathering information and how we evaluate that. And then we start to go down a little further and a little further. So at that point, hopefully within the next year, we'll have something that we'll use to start to work with the youth service bureaus. But we are not trying to interfere with their funding. We're not trying to interfere with what they're doing right now. And we will try and gather more information that we can use in actually making determination on the progress and the programming that they're doing and how effective it is.
I appreciate that. I think it's got a lot of good potential. I appreciate the information. Thank you, Madam Chair.
Thank you.
Thank you. Representative Retigliano, followed by Representative McCarty.
Thank you, Madam Chair. Just a couple of clarifying questions. So the way the bill's written today, it only affects towns, just to be clear, over 90,000. It doesn't affect all towns.
Representative Walker.
Thank you, Madam Chair. That is correct. And it's not going to be with youth service bureaus. It's going to be with juvenile review boards.
Oh, and excuse my ignorance. That's why I asked the question, but
That's okay.
so is this for crimes, for lack of a better word, that are committed in one of these towns with 90,000, or residents of the communities of over 90,000?
Representative Walker.
Through you, Madam Chair, it will be kids that are referred to the court services in that town.
So they,
Representative Retigliano.
so, thank you, Madam Chair. So if, let's just, you're from New Haven. So say this kid from West Haven gets in trouble in New Haven, he's still eligible to be part of this program. He doesn't actually have to be a resident of New Haven.
No.
No.
Representative Walker.
Through through you, Madam Chair. No, it would, if the crime is occurring in New Haven, it would be addressed because the police departments are also part of the foundation of how we're developing this program.
And
Representative Retigliano.
thank you, Madam Chair. And my last question would be is that it calls for you to develop a consultation with the Consultation Center at Yale.
Yes.
What is so special about the Consultation Center of Yale? Do we not have another Connecticut institution that maybe could help develop this plan?
Representative Walker.
Through you, Madam Chair, they are part of our juvenile justice policy and operation, the JJPOC, and they've been providing us with different evaluations of programs that are working with the juvenile review boards in the large cities right now. So they are the entity that has started looking and evaluating and helping us develop the plan. Yes, there are probably going to be other entities that'll be involved, but so that we don't have to incur additional costs. We have an arrangement with them right now, so that way we can continue down our, right, through you, Madam Chair.
Representative Retigliano, does that answer your question, sir?
It does sort of answer my question. I just didn't know if this was sort of is this a faculty-led organization or is this a student-led organization? This Consultation Center at Yale.
Representative Walker.
Through you, Madam Chair, it is a faculty-led organization.
Okay.
Representative Retigliano.
All right, that's slightly more comforting, but thank you for your answers and I appreciate it. Thank you, Madam Chair.
Thank you. Representative McCarty.
I am very.
Thank you very much, Madam Chair. And first, I'd like to say how much I respect Representative Walker and all the good work that you have done in that regard. But I have to tell you that I'm quite involved with my youth service bureaus in my districts, and they're quite concerned about the change in the language in the statute. And so I'm going to pull back today, but I'm asking you if the youth service bureaus could be at the table as you move forward with the change in the statute language, because they do such tremendous work in our community and really try to help with what your mission is going forward. So I just want you to know that I'm with you. You know, I've always supported the initiatives with our diversionary programs and doing what we can for our youth, but I'm worried about taking on the smaller communities, the youth service bureaus, what they are doing now in that regard. So would you assure me, I'm going to be no today, but that if the youth service bureaus are at the table, that we can figure out what we're doing, because I think the goal is probably the same, but there's some worry.
Representative Walker.
Thank you, Madam Chair. That is why we took the youth service bureaus out of the bill, because we've had a difficult way of understanding what diversion is, and the entity of the job of diversion is the critical part to keep the kids out of the system. So what we're looking at is trying to develop different types of methods of working with diversion and incorporating it in the services that we use with kids that have touched the criminal justice system just the first time, so that they don't continue. The youth service bureaus around the state do a variety of things, but we need a little bit more. We need services that are a little bit more directed to work with the courts and with the police department, so that we make sure that nothing continues in that area. So we always try and make sure, but the youth service bureaus are not going to be affected. They're not going to lose their money. I keep telling everybody that. So I want to repeat it again. They're not going to lose any money. We're not going to affect it. This is something that is going to be developed with the juvenile review boards, especially with the larger cities right now.
Representative McCarty.
I thank you for those comments and trying to comfort a little bit, but I still have a little worry about what the language in that statute would look like, and just preserving some of those really wonderful services that the youth service bureaus do in prevention work. So thank you for giving me your response
Yes,
today.
and
Thank you.
through you, Madam Chair, I want to give you my word that I am not trying to destroy or eliminate or separate any of the YSBs in what they're doing.
Okay, thank you.
Representative Harrison?
Thank you, Madam Chair. My question is just to clarify Representative Walker's remarks. So she said the funding for this, if I heard it correctly, is in the DCF budget.
Representative Walker?
Through you, Madam Chair, that is correct.
So I'm
Representative
just,
Harrison?
thank you. Thank you. I'm just clarifying because some of the information that we did get from OFA said that it was not included in the budget. So if you could speak to that, because I want to make know whether it was in the budget that got voted out of committee on Tuesday, or if it wasn't, and what this sort of discrepancy is, to clarify for all of us. Thank you, Madam Chair.
Representative Walker?
Thank you, Representative. What happened was we decided to do the juvenile review boards. The money in the Department of Children and Families budget is $4.2 million. It's on page 206. I did not get the name changes in time in the bill. So therefore, that's why it says Youth Service Bureau in the bill. It is going to be used for juvenile review boards, and that was the discussion that we had. Through you, Madam Chair.
Representative, thank you, Representative Walker. Representative Harrison?
Thank you for that. So we're going to change the bill so that it reflects that it's going to be juvenile review boards. Through you, Madam Chair.
Representative Walker?
Through you, Madam Chair, that is absolutely correct.
Representative Harrison?
Perfect. So does that also mean that this bill is going to mandate that all municipalities under 70,000 are going to be required to have a youth services bureau, or is that also going to be struck from the bill?
Representative Walker?
Through you, Madam Chair, that is correct.
Representative Harrison?
Thank you so much, Madam Chair, for, clarifying that and getting it on the record for all of us. Thank you.
Thank you. Are there any other comments or questions? Seeing none. Madam Administrator, could you call the roll, please?
Senator Austin,
Senator Austin votes in the affirmative.
Representative Walker,
Representative Walker votes in the affirmative.
Senator Hartley, Representative Exum,
Representative Exum votes yes.
Representative Paris,
Yes. I don't know.
Senator Berthel,
Senator Berthel votes yes.
Representative Nuccio,
Rep. Nuccio is yes.
Senator Anwar,
Senator Anwar votes yes.
Representative Baker,
Representative Baker votes yes.
Representative Belinsky, Representative Callahan, Representative Candelaria, Representative Chaleski,
Representative Chaleski votes yes.
Representative Curry, Representative Dathan,
Everybody disappeared.
Representative DiCaprio.
Representative Dathan votes yes.
Thank you, ma'am. Representative DiCaprio,
DiCaprio votes yes.
Representative Delaney, Representative Delnicki,
Yes.
Representative Dillon,
Yes.
Representative Felipe,
Representative Felipe votes yes.
Senator Flexer, Representative Fonsello,
Representative Fonsello votes yes.
Representative Garabay,
Garabay votes yes.
Representative Gibson,
Representative Gibson votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes yes.
Representative Gonzalez,
Representative Gonzalez vote yes.
Representative Haddad,
Representative Haddad votes yes.
Representative Hall, Representative Harrison,
Representative Harrison votes yes.
Representative Hoxa,
Representative Hoxa votes yes.
Representative Johnson,
No.
Representative Johnson votes yes.
Representative Khanna,
Representative Khanna votes yes.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Lesser, Senator Marks,
Senator Marks votes yes.
Representative McCarty,
Representative McCarty votes no.
Senator McCrory,
McCory's a yes.
Representative Nolan, Representative Porter, Representative Osborne, Representative Reyes, Representative Rosario,
Rosario in the affirmative.
Representative Retigliano, Representative Ryan,
Representative Ryan votes yes.
Representative Sanchez, Senator Slapp,
Senator Slap votes yes.
Representative Sims,
Representative Sims in the affirmative.
Senator Summers, Representative Tersiak, Senator Winfield, Representative Zawistowski,
Madam Administrator, I think Representative Paris is on. I see him on, he's got his hand up.
Thank you. Representative Paris,
Madam Administrator, Representative Paris votes in the affirmative. Thank you.
thank you, sir.
Thank you, Madam Administrator. We're going to leave the votes open till 3:30. Up next is item number 3. Substitute for Senate Bill number 946, an act concerning the Connecticut Home Care Program for the Elderly, proposed action. J, up to the floor. Is there a motion for this one?
So move.
Moved by Representative Walker, seconded by Senator Bethel. Discussion, seeing none. Madam Administrator. Call the roll, please.
Senator Austin,
Senator Austin votes in the affirmative.
Representative Walker, Senator Hartley, Representative Exum,
Representative Exum votes yes.
Representative Paris, Senator Berthel,
Senator Berthel votes in the affirmative.
Representative Nuccio,
Representative Nuccio abstains because I don't understand it well enough.
Senator Anwar,
Senator Anwar votes yes.
Representative Baker, Representative Belinsky, Representative Callahan, Representative Candelaria, Representative Chaleski,
Representative Chaleski votes yes.
Representative Curry, Representative Dathan,
Representative Dathan votes yes.
Representative DiCaprio,
Representative DiCaprio votes yes.
Representative Delaney, Representative Delnicki,
Yes.
Representative Dillon,
Yes.
Representative Felipe,
Representative Felipe votes yes.
Representative Fonsello,
Representative Fonsello votes yes.
Representative Garabay,
Garabay votes yes.
Representative Gibson, Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes yes.
Representative Gonzalez,
Representative Gonzalez vote yes.
Representative Haddad,
Representative Haddad votes yes.
Representative Hall, Representative Harrison, Representative Hoxa, Representative Johnson,
Representative Johnson votes yes.
Representative Khanna,
Representative Khanna votes yes.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner, Senator Lesser, Senator Marks,
Marks votes yes.
Representative McCarty,
Representative McCarty votes yes.
Senator McCrory,
McCoy, yes.
Representative Nolan, Representative Porter, Representative Osborne, Representative Reyes, Representative Rosario,
Rosario's in the affirmative.
Representative Rutigliano, Representative Ryan,
Representative Ryan votes yes.
Representative Sanchez, Senator Slapp,
Senator Slab votes yes.
Representative Sims,
Representative Sims in the affirmative.
Senator Summers, Representative Tersiak,
Yes, please.
Senator Winfield, Representative Zawistowski.
Madam Administrator,
Hello, Representative Gibson, how would you like to vote, sir?
I'd like to vote yes, please. Thank you so much.
Thank you.
Madam Administrator, are you all set? Representative Osborne, I think. You want to vote?
Madam Chair, why don't we let Representative Osborne settle in? She can come see me and,
Oh, good.
all right?
Okay, are you all set then?
Yeah, okay.
Okay, we're gonna go up to item number 4, Senate Bill number, substitute for Senate Bill number 977, an act concerning medical assistance for surgery and medical services related to the treatment of obesity.
So moved.
Moved by Senator Bethel, seconded by Representative Sims. Discussion, seeing no, Representative Nuccio.
Thank you. Thank you. Actually, I'm gonna pass and let Senator Berthel go because I can't locate my notes on this one. Sorry.
Senator Berthel.
Thank you. Excuse me. Thank you, Madam Chair. Quickly, this legislation is, it's not the first time this legislation has been before this committee. This bill actually passed out of the Senate unanimously last year. And while it doesn't do everything that I personally would like it to do, it's not about me. It's about us serving and helping the people that we represent. So I think this is an important expansion of access to bariatric surgery services for the good people of our state. And I urge adoption. Thank you, Madam President.
Thank you. Is there any other
Madam
comments or
Chair, sorry.
questions? Representative Nuccio, followed by Representative Harrison.
Thank you, Madam Chair. And I do have a question for OFA. And it's kind of around how we would determine the cost of this. I don't know if OFA is, if they're still here.
Well, they're here for the whole duration. They're not going anywhere. And one of you let Neil sit down? Thank you.
We can always make them sit in the middle.
Excuse me, what was the question again?
This is in regard to Senate Bill 977. This is another bill that I believe, well, actually, it's Medicaid, so it wouldn't be insurance, but from the perspective of the notes that you have, I find that when we have these kind of mandates that are increasing Medicaid or insurance and stuff, that you don't really have a good grip on the cost of this. And I think, is this an expansion of a current service or is this a totally new service here? The obesity treatment?
Looks to be expanding based on our brief comments on it. Expected the costs associated with expanding the number of eligible individuals.
Okay, so do we have any cost indicators on the existing people that have this? This is a really expensive procedure.
I don't know.
Okay. I don't know if there's any way to find out. I'd like to understand what our current costs are related to the bariatric surgeries, and if we're expanding, what we should have enough information there to kind of extrapolate out if we expand eligibility.
One of the problems, going to your broader question on putting my Medicaid hat back on, it's been a while. Medicaid costs basically three factors. You have the eligible population, you have what rates are established to reimburse for it, and the utilization. I don't know to what extent, and based on text and looks I'm getting, I don't know if we have any of this data on this population yet, which makes putting a cost on something like this difficult for us.
Okay, I would think though, if it was an expansion, we would have something somewhere, but I understand you don't have that now. I'm not asking for that now. And I would like to see if there's something we can sit down and look at, if this is an expansion of an existing process, what we're spending on this currently. And then if we can apply some rationale to that, just looking at obesity statistics and such, and then kind of come up with what we think the number is. Thank you, Madam Chair. Is this in the budget?
My understanding is that this one is not in the budget yet, but will be being considered once we have a final fiscal note.
Okay, so I would ask that before we do that, we get some sort of understanding of the existing populace and then do some algebra there to come up with what we think this is going to cost going forward.
Okay. Promise to do regular math, but not algebra.
I like algebra.
You may, I don't.
I'll do the algebra. You can put the regular math in, okay?
Okay,
All right. I'll work with Neil to develop the algebra.
Okay, you can do that.
All right, thank you very much.
Representative Harrison?
Thank you, Madam Chair. I think the good ranking covered a lot of my questions. Thank you to Neil. I guess my only additional question would be, we don't know how many people are going to become eligible, but can we extrapolate what percentage of people in the population of Medicare or in the population of regular insurance generally use this procedure?
I think we will do that as we move forward.
Thank you.
Thank you.
And this is not in the budget, you confirm?
No.
Thank you.
Is there any other comments or questions? Representative McCarty?
Thank you very much. Just a very quick comment, if I may, that the medical evidence has shown that this issue with obesity is really, a lot of it is driven by genetics. And so these individuals need to have the support to have the surgery, in my opinion. In France, as you know, I'm a big Francophile. They did a huge study in the country, and they proved from their study that almost 75% of the lives, those that had the surgery compared to the non-surgery, saved lives. So I'm supportive of this bill. I do think in the ultimate end, it will be a cost savings measure. So I just wanted to put that out there. Thank you.
Thank you. Any other comments or questions? Representative Sims?
Thank you, Madam Chair. I just want to echo the comments of my good colleagues on the other side. That this is a bill that's that's very important to me, but it's just very, very overdue that this bill needs to be going forward. I will tell you personally, I had 3 siblings who all passed away from heart disease, which was complication from obesity. And I'm talking about within the past 6-year span, and they were all relatively young. And if we had this bill before us then and approved this bill, my siblings could have been potentially living till to this day. So I just want to share with my colleagues that this is a good bill that ought to pass. We need to do everything in our power in this state to make sure that no other families have to be dealing with this kind of devastation. So I urge each and every one of you to support this bill going forward. Thank you so much, Madam Chair.
Thank you, Representative. Any other comments or questions? Seeing none, Madam Administrator. Oh, I'm sorry, Representative Osborne.
Thank you, Madam Chair. I am fully in support of this bill and, you know, when we think about obesity and the risks to health,
I can't hear you at all.
I'm
Not
so
even a
sorry.
little
I
bit.
will lean into it then. So when we think about, I'm a full supporter of this bill, and when we think about obesity and we think about the risks to health, we commonly think of heart disease, as Representative Sims was speaking of. But I'm a cancer survivor, and when I went to the doctor to get the treatment I needed to save my life, I followed my doctor's advice, and my insurance company covered it. I had surgeries. I had reconstructive surgeries. All of that was paid for. I had my ovaries removed. Why? Because they produce estrogen, and that's the next safest thing I can do. I had chemotherapy. I had radiation. All of that was paid for by my doctor. And I did those things because my doctor told me that's what we needed to do to save my life. So I will be 8 years cancer-free come May 1st. And the one piece of my doctor's recommendations I cannot follow, or I could not follow if I could not pay for it on my own, would be medication that I would need or surgery that I might need someday because the radiation killed my thyroid, to maintain a healthy weight. The only risk factor that I have not been able to ameliorate has been my doctor's number one advice, which is maintain a lean, healthy body weight, because that's my only risk factor for recurrence. And I think it's shameful that we treat obesity differently than any other disease of the body or of the mind in our insurance, and certainly in our state-run Medicaid programs. And far be it from us to decide what a patient needs above what a doctor advises. So I'm fully supportive of this bill, and I'm fully supportive of doing what we need to remove the shame and the judgments in any of our legislation regarding medical conditions like obesity. Thank you very much, Madam Chair.
Thank you. Thank you. And we're so glad you're cancer-free. Are there any other comments or questions? Seeing none, Madam Administrator, if you could call the roll, please.
Senator Austin,
Senator Austin votes in the affirmative.
Representative Walker,
Representative Walker votes yes.
Senator Hartley, Representative Exum,
Representative Exum votes yes.
Representative Paris, Senator Berthel,
Senator Berthel votes in the affirmative.
Representative Nuccio,
Representative Nuccio votes no.
Senator Anwar,
Senator Anwar votes yes.
Representative Baker,
Representative Baker votes yes.
Representative Belinsky, Representative Callahan,
Where's Boyensky?
Representative Candelaria, Representative Chaleski,
Representative Chaleski votes no.
Representative Curry, Representative Dathan,
Representative Dathan votes yes.
Representative DiCaprio,
DiCaprio votes no.
Representative Delaney, Representative Delnicki,
Yes.
Representative Dillon,
Yes.
Representative Felipe,
Representative Felipe votes yes.
Senator Flexer, Representative Fonsello,
Monticello votes yes.
Representative Garabay,
Garabay votes yes.
Representative Gibson,
Gibson votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes yes.
Representative Gonzalez,
Gonzalez vote yes.
One more time for me, ma'am.
Yes.
Thank you, ma'am.
Thank you.
Representative Haddad, Representative Hall,
Representative Hall votes yes.
Representative Harrison,
Representative Harrison votes no.
Representative Hoxa,
Representative Hoxa votes yes.
Representative Johnson.
Representative Johnson votes yes.
I need your camera on, please, ma'am.
Representative Johnson votes yes.
Thank you. Representative Khanna,
Representative Khanna votes yes.
oh, one more time for me. I need to see your face.
Oh, Representative Khanna votes yes.
Thank you, ma'am. Representative Kennedy,
Kennedy votes yes.
Senator Kushner,
Kushner, yes.
Senator Lesser,
Lesser, yes.
Senator Marks,
Marks, yes.
Representative McCarty,
Representative McCarty votes yes.
Senator McCrory,
Senator McCrory is yes.
Representative Nolan, Representative Porter, Representative Osborne,
Osborne, yes.
Representative Reyes, Representative Rosario,
Rosario in the affirmative.
Representative Retigliano,
Yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Sanchez, Senator Slapp,
Senator Slab votes yes.
Representative Sims, Senator Summers, Representative Terciak,
Yes.
Senator Winfield, Representative Zawistowski. Well, set Madam Administrator. Almost gave you an elected title. Up next is, I'm sorry. Up next is number 5, Senate Bill number 978, an act concerning expansion of covered Connecticut program, JFS to the floor, LCO 6916.
So moved.
Moved by Representative Walker. Is there a second? Second. Seconded by Representative Exum. Discussion? Seeing no discussion. Oh, I'm okay. Representative Harrison.
Thank you, Madam Chair. I do have some questions. It's my understanding that the language in this is also included in SB 10 that we previously did this morning or earlier today.
Well, this is changing the covered CT from 175 to 200 solely, not all the other items that were in SB 10, and is totally incorporated in the budget. And gives a vehicle for covered CT should SB 10 not make it through.
Thank you for that. Is this totally covered with a federal reimbursement, or is the state going to have to increase what they budget for this?
State cost is 4.5 million in year 1 and 37 million in year 2. The 4.5 million is directly reflective of the fact that the start date is January 1 of 2024.
So because we're increasing the FPL, does that mean that the state is going to have to contribute more, or is the federal government going to also give us some additional money to help cover this?
The federal government will give more dollars. We have to make a change when, as you know, appropriations votes on a number of items after the budget goes through, where they submit to where DSS submits to the federal government changes that we have made relative to rates and coverage, and so they'll give us more federal dollars. But the state cost is 4.5 million in year 1 and 37 million in year 2.
So my next question, this covers a gap of people. Are they going to be required to have a copay under this program?
I'm not certain if they have a copay in the covered CT or any of the other programs, but the copays would be minimal based on the fact that these people are not, they are, some of their socioeconomic status is less.
Understood, but makes it a little bit more of a parity with, you know, the rest of it policies. Most of us have copays, so that was just where I was asking the question from. At this point, thank you, Madam Chair.
Thank you. Any other questions or comments? Seeing none. Madam Administrator, if you could call the roll, please. Wait a minute. Representative Chaleski?
Sorry, Madam Chair. I
You
just,
guys gotta, we're trying to speed this up a little bit.
sorry about that. Just
Okay.
really quickly off of the representative's comments and questions, does that, the copay is that incorporated into the cost that you just described?
This is a cost of the budget. I don't, sometimes we charge copays and sometimes we don't, depending on the programs and depending on the socioeconomic status. If someone's struggling to pay, and not that everybody doesn't struggle to pay different things, but if someone's really struggling to pay and their socioeconomic status is such that it's hard for them to make a choice between feeding their family or paying their rent, I'd rather they did both of those in accordance with the bill. And so we're gonna see what we can do here, but we're not necessarily going to charge them copay if it's not required by
Okay.
federal law.
Okay, I was just curious how that affected the overall cost of the program. Thank
Yep.
you, Madam Chair.
Thank you. And if I don't see you, guys got to let me know because I don't sometimes see you when you're raising your hand. So, and I go very quickly. At this point, I'm going to go quicker than normal, and I already go very quickly. So Representative Nuccio for,
It would be my first time, ma'am. I ran out. It would be very quick.
was everybody's first time. No, not
Okay.
a lot of questions.
So with the covered Connecticut plan, it is my understanding that we have the option of charging premium or copays or any cost share along with this program. And I would be interested, again, since I know this is in the budget, but I think there may be some opportunity or wiggle room, which might make funds available for other things to look at. If we were to charge a $5 copay for visits, or if we were to charge a 2% of the actual cost of the plan for these people, understanding that their FPL level is too high for Medicaid, but yet it's still lower income. If we were to shift any cost for the insurance product back to a small piece of it, what would that garner us in savings? And I'm thinking, if Neil, if you can write that down, we can maybe talk about that post meeting. I'm going to be a yes on this today, but I really would like to see if there's a way to shift just a little bit of the responsibility of this insurance plan onto the person who's getting it, rather than it being 100% on the state.
So duly noted. Any other comments or questions? Seeing none, Matt, I think it's true this time. Could we call the roll?
Senator Austin,
Senator Austin votes in the affirmative.
Representative Walker, Representative Walker votes yes. Senator Hartley, Representative Exum, Representative Paris, Senator Berthel,
Senator Berthel votes no.
Representative Nuccio,
Rep. Nuccio votes yes.
Senator Anwar.
Senator Anwar votes yes.
One more time, sir. I didn't catch your video.
Senator Anwar votes yes.
Oh, your video's not coming through. No. I'm gonna pass you. for-
Senator Anwar votes yes.
No, you may not have service, sir. So I'm gonna pass you for just a moment, and we'll see if that technical issue rights itself. I'm gonna continue with the roll. Representative Baker,
Representative Baker votes yes.
Representative Belinsky, Representative Callahan, Representative Candelaria, Representative Chaleski,
Representative Chaleski is a no.
Representative Curry, Representative Dathan,
Representative Dathan is a yes.
Representative DiCaprio,
DiCaprio's no.
Representative Delaney, Representative Del Nicky,
Yes.
Representative Dillon,
Dillon, yes.
Representative Felipe,
Representative Felipe votes yes.
Senator Flexer, Representative Fonsello,
Monticello votes no.
Representative Garabay,
Garabay votes yes.
Representative Gibson,
Representative Gibson votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes no.
Representative Gonzalez,
Representative Gonzalez, vote yes.
Representative Haddad, Representative Hall, Representative Harrison,
Representative Harrison votes no.
Representative Hoxa,
Representative Hoxa votes yes.
Representative Johnson,
Representative Johnson votes yes.
Representative Khanna,
Representative Khanna votes yes.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Lesser,
Lesser, yes.
Senator Marks,
Senator Marks votes yes.
Representative McCarty,
Representative McCarty votes yes.
Senator McCrory,
McCrory is a yes.
Representative Nolan, Representative Porter, Representative Osborne,
Osborne, yes.
Representative Reyes, Representative Rosario, Representative Rutigliano.
Rosario in the affirmative. Rosario in the affirmative.
I've got you, sir. Thank you. Representative Ryan,
Representative Ryan votes yes.
Representative Sanchez, Senator Slapp,
Senator Slapp votes yes.
Representative Sims,
Representative Sims in the affirmative.
Senator Summers, Representative Terciak,
Yes.
Senator Winfield, Representative Zawistowski, Senator Anwar.
Senator Anwar votes yes.
Thank you, sir. All set, Madam Administrator? Thank you. Up next is number 6, substitute for Senate Bill number 1001, an act concerning certain sewage disposal systems. I'll entertain a motion for this bill. Representative Walker, and Representative Sims. Discussion. Senator Berthol.
Yes, Madam Chair. I do not have a question regarding the context of the bill or the legislative intent, but I do have a concern at line 33 through 38, prescribe appropriations, which is not the normal policy of this committee. So I would like to offer a verbal and what should be, by all measure, a friendly amendment to strike lines 33 through 38 out of this bill. We do not normally prescribe appropriations, and this bill, the money for this bill is not in the budget. Thank you, Madam Chair, and I'm not sure what else I need to do for a friendly verbal amendment. But I'm offering it. You want to second that?
Friendly, I'll second the friendly amendment, friendly.
Neil, do we know that if this is in the budget? I thought we took out all the sums of. I'm sorry. No, it's fine.
I don't have the substitute language in front of me.
6919. I just want to double check because I thought we removed this already. I know, I'm just.
Secondary question was, I don't believe these are in the budget,
They are not.
whether it's
I
in the
know.
bill or not.
Yeah.
just want to double check to see what they did. I know, I just want to make sure. You might not have gotten the right language given to us, so.
According to LCO, that section's out in the substitute bill.
Okay, thank you.
Madam
So-
Chair, can we,
Would not be online.
would not be online.
Until we vote on it, it's not online.
Okay. All right, thank you, Madam Chair.
Thank you. So we don't need the amendment. But we're withdrawing the amendment.
Yeah, I'll withdraw my amendment.
Yeah. Is there any other questions on this bill? Representative Del Nicky?
Thank you, Madam Chair. I will be voting no on this. I'm concerned about the fact that it's going from the Department of Environmental Protection to Department of Public Health, and quite frankly, they're, in my opinion, based on my 32 years of experience in wastewater, I question that move in and of itself. So I will be a no on this.
Thank you. Are there any other questions or comments? Seeing none. Madam Administrator, if you could call the roll, please.
Madam Chair, if I may, just clarify that the motion is for a JFF LCO 6919. Yes, ma'am. I'm sorry. I thought I said that. We're voting on substitute for Senate Bill number 1001 JFS LCO 6919. Thank you, Madam Chair. Senator Austin,
Senator Austin votes in the affirmative.
Representative Walker,
Representative Walker votes yes.
Senator Hartley, Representative Exum, Representative Paris, Senator Berthel,
Senator Berthel votes no.
Representative Nuccio,
Representative Nuccio votes no.
Senator Anwar votes yes.
Representative Baker,
Representative Baker votes yes.
Representative Belinsky, Representative Callahan, Representative Candelaria, Representative Chaleski,
Representative Chaleski votes no.
Representative Curry, Representative Dathan,
Representative Dathan votes yes.
Representative DiCaprio,
Caprio votes no.
Representative Delaney, Representative Del Nicky,
No.
Representative Dillon,
Yes.
Representative Felipe,
Representative Felipe votes yes.
Senator Flexer, Representative Fonsello,
Representative Fonsello votes no.
Representative Garabay,
Garabay votes yes.
Representative Gibson, Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes no.
Representative Gonzalez,
Representative Gonzalez vote yes.
Representative Haddad,
Haddad votes yes.
Representative Hall, Representative Harrison,
Representative Harrison votes no.
Representative Hoxa,
Representative Hoxa votes no.
Representative Johnson,
Representative Johnson votes yes.
Representative Khanna,
Representative Khanna votes yes.
Representative Kennedy,
Kennedy votes no.
Senator Kushner,
Kushner votes yes.
Senator Lesser, Senator Marks,
Marks votes yes.
Representative McCarty,
Representative McCarty votes no.
Senator McCrory,
McCoy is a yes.
Representative Nolan, Representative Porter, Representative Osborne,
Osborne, yes.
Representative Reyes, Representative Rosario,
Rosario in the affirmative.
Representative Retigliano,
No.
Representative Ryan,
Votes yes.
Representative Sanchez,
Sanchez, yes.
Senator Slack,
Senator Slack votes yes.
Representative Sims,
Representative Sims in the affirmative.
Senator Summers, Representative Terciak,
Yes.
Senator Winfield, Representative Zawistowski. Thank you very much, Madam Administrator. Up next is item number 7, substitute Senate
Madam
Bill.
Administrator. I'm sorry, Senator Olson.
Go ahead, Representative.
Thank you so much. Madam Administrator, I'd like to vote yes. This is Rep. Gibson.
Gotcha, Representative Gibson. Representative Exum.
Representative Exum votes yes. Thank you.
Thank you, ma'am. Thank you. And now we're going to move on to item number 7, substitute for Senate Bill number 1096, an act concerning the charter school approval process. JF to the floor. Is there a motion?
So moved.
Moved by Senator Berthel. Is there a second? Second by Representative Exum. Discussion? Seeing no discussion. No. No. Do you have any discussion? We're gonna lose the whole bill. God, we need to stop on this bill. We have everybody that's not doing anything on this. Let it go through. You want it to go through. No, no, it's not that. If she puts that in here, this is not stop. Seeing no discussion, Madam Administrator, if you call the roll, please. Senator Austin. Senator Austin votes in the affirmative. Representative Walker.
Representative Walker votes yes.
Senator Hartley. Representative Exum.
Representative Exum votes yes.
Representative Paris. Senator Berthel.
Yes.
Representative Nuccio.
Yes.
Senator Anwar.
Senator Anwar votes yes.
Representative Baker.
Representative Baker votes yes.
Representative Belinsky. Representative Callahan. Representative Candelaria. Representative Chaleski.
Representative Chaleski is a yes.
Representative Curry. Representative Dathan.
Representative Dathan is a yes.
Representative DiCaprio.
DiCaprio's a yes.
Representative Delaney.
Representative Delaney votes yes.
Representative Delnicki.
Yes.
Representative Dillon.
Yes.
Representative Felipe.
Representative Felipe votes yes.
Senator Flexer. Representative Fonsello.
Representative Fonsello votes yes.
Representative Garabay.
Garabay votes yes.
Representative Gibson.
Representative Gibson votes yes.
Representative Gilchrist.
Representative Gilchrist votes no.
Senator Gordon.
Senator Gordon votes yes.
Representative Gonzalez.
Gonzalez votes yes.
Representative Haddad. Representative Hall. Representative Harrison.
Representative Harrison votes yes.
Representative Hoxa.
Representative Hoxa votes yes.
Representative Johnson.
Representative Johnson votes no.
Representative Khanna. Representative Khanna. Representative Kennedy.
Kennedy votes yes.
I'm sorry, ma'am. Could you repeat? I'm sorry.
Kennedy votes yes.
Thank you, ma'am. Senator Kushner.
Senator Kushner votes no.
Senator Lesser.
Senator Lesser votes no.
Senator Marks.
Senator Marks votes no.
Representative McCarty,
Representative McCarty votes no.
Senator McCrory,
McCoy is a yes.
Representative Nolan, Representative Porter, Representative Osborne,
Osborne is a yes to move it out of committee.
Representative Reyes, Representative Rosario,
Rosario's in the affirmative.
Representative Retigliano. Representative Ryan,
Representative Ryan votes yes.
Representative Sanchez,
Sanchez, yes.
Senator Slapp,
Senator Slatt votes no.
Representative Sims, Senator Summers, Representative Terciak,
No.
Senator Winfield, Representative Zawistowski. Madam Administrator, are you all set?
Sorry. I'd like to change my vote to a no, please. Thank you.
All set. Thank you. Up next is substitute for Senate Bill number 1109, an act concerning Medicaid reimbursement to the community living arrangements, intermediate care facilities for individuals with intellectual disabilities and residential care homes and nursing facilities. JFS to the floor, LCO 6926. Is there a motion?
So moved.
Moved by Representative Walker. Is there a second? Second by Representative Gilchrist. Discussion. Representative Kennedy.
Thank you, Madam Chair. Madam Chair, is this currently being done or what changes in this that we aren't already doing? Through you, Madam Chair.
I'm sorry, could you repeat that?
Sure, I'm sorry. Isn't this already being done currently? And I'm just wondering what changes in this bill that's not already being done
Okay,
for you.
well, that's fine. There's no net fiscal impact on this bill, and the changes are the changes relative to this bill are on starting on page 5 of 30. For fiscal years, the rate paid to a facility may be higher than the rate paid to the facility for the fiscal year ending in June 30th, 2023, if a capital improvement approved by the Department of Developmental Services was made. Then the next change is on page 6 for fiscal year ending June 30th, 2024. And each subsequent fiscal year, the commissioner may, in the commissioner's discretion and within available resources, provide pro rata fair rent services. Let me say, make sure I'm talking to the same. This is. Yeah, make sure I have the right
You're good.
JFS.
Actually,
I have to go back to the right JFS. I
okay,
apologize.
no, I appreciate it. Thank you very,
Because the JFS pulled out the fiscal components of it. And there may be parts that people want in, but we think I need an additional look at it in order to.
thank you, Madam Chair. I appreciate that. Is there a 5% holdback on the Medicare on this for you, Madam Chair?
There's not, that's not part of this
That's
right
what
now.
okay.
That's the
okay.
change.
And just on the redistribution in here, how is that going to be accomplished through you, Madam Chair?
Say it again.
On the redistribution of this, how is that going to be accomplished through you, Madam Chair? And I apologize, I don't have the section in front of me.
No, that's fine. So again, to your first question, for this LCO,
this would provide pro rata fair rent increases to facilities which have documented fair rent additions placed in service to the cost report years that are not otherwise included in the rates issued. And the next change is there will be no increase to rates based on inflation or any inflationary factor for the fiscal years ending 22 and 23, notwithstanding any other provisions of the general statutes or regulations adopted there under. Any subsequent increase to rates based on inflation as authorized for any subsequent fiscal year shall be adjusted as determined by the commissioner. The rate of inflation shall be computed based on the percentage increase, if any, in the most recent calendar year average in the gross domestic product. Any increase to rates based on inflation shall be applied prior to the application of any other budget adjustment. The Commissioner of Social Services shall determine whether and to what extent a change in ownership of a facility shall occasion the rebasing of the facility's costs. And then that's on 12 of 29.
Thank you, Madam Chair. And I think you said it, but I just want to clarify, and this has no net fiscal impact, correct?
No net fiscal impact. That is correct.
Thank you very much, Madam Chair.
Are there any other comments? Representative Nuccio, Representative DiCaprio.
Thank you, Madam Chair. Just, is there any impact to nonprofits, passing this bill?
I'm sorry, could you please repeat that, sir?
Again, Madam Chair, are there any impacts to nonprofits by passing this legislation?
Well, that would all depend on, I don't think that this impacts the general nonprofits that you're talking about. I don't know if you're talking about nursing homes, which we don't generally refer to as this. The nonprofits tend to be a different entity. Sir.
Okay, I just saw some testimony to that effect, so I just
There is some concern that nursing homes have about this piece of legislation. I'm sure it will be a great debate over the next couple of months.
Thank you, Madam Chair.
Thank you. Representative Bethel. Senator Bethel.
Between the name pronunciation and the chamber, I don't know, it's getting.
It's a bad thing to be a representative. I would say we're clearly the better house.
Hey.
I've had the pleasure of Madam Chair.
Yes.
For the record, I've had the pleasure of serving in both chambers. So, Madam Chair, I'm confused by, and I appreciate you're going through the changes that are here in the bill. The thing I'm confused by is there's language that you just articulated to us that talks about rate increases, right? Adjusted for inflation and so on and so forth around lines 161. And I'm just scrolling through, it looks like at 375, 380. The report back from OFA is that there's no net impact, no fiscal note on this. How is it possible that we're paying higher rates adjusted for inflation and there's no fiscal impact? That doesn't seem logical to me. And please help me understand if I'm not understanding.
No,
Maybe Neil can, sorry, Neil, you looked comfortable. But thank you.
Mr. Ayers.
Trust me, I'm not comfortable. According to people far wiser than I about this, the changes that you're seeing in there are clarifying, defining current practices that weren't in statute, but were already part of the process. So it's not adding anything in new costs because the department's already doing this. This is just clarifying and conforming statute to current practice.
Okay.
Does
Through
that
you,
answer your question, Senator?
not quite, but through you, Madam Chair, to Neil. So you're saying that right now so this is clarifying language for payments that we're already making? Is that a simpler way for me to understand it? So you're saying that this is just saying we're tightening up the language as to how we have adjusted the rates, but those rates are already being paid. We're not going to increase a rate, even though in the language of the bill, it says there's an increase. Through you, Madam Chair.
Mr. Ayers.
Watching my phone. I believe any rate increases would already have been contemplated, and this is just clarifying in statute how they're normally done.
Senator Berthel, I
Okay.
got the name and the title right.
Thank you, Madam Chair. That's awesome. I appreciate that. Madam Chair, through you, thank you, Mr. Ayers, for that. I'm gonna, as much as I really want to support this, because I think it's the right thing to do, I'm gonna just flag this for a no. I think I want to dig a little deeper and make sure that, and Neil, not that I don't trust what you're saying, you know that I do. I'm just still a little confused as to what we're actually doing here. And maybe we can sit down and chat some more about that. But thank you for the opportunity to ask a question.
Anytime. Representative Nuccio?
Thank you, Madam Chair. I don't know if Neil wants to, I don't know that you should have moved yet, but I have a couple of questions kind of along that same line. As I'm looking at this bill here, lines 374 through 377 say a rate of inflation shall be computed based on the percentage increase.
You're gonna be sharing the TA?
The most recent calendar year average and the gross domestic product deflator over the average of the previous calendar year. I have two questions on that. One is, I like these words, I'm an accountant. So in relation to this, since we're seeing high inflation right now, would that be an increase year over year that would automatically be granted?
Mr. Ayers?
I believe if that index that they're using is going up, that rate would increase by that. If that makes sense.
Representative Nuccio?
So would the rate increase by the inflationary, so in this case, if inflation is at 7%, would that rate increase by that corresponding 7%? Says it's based on a percentage increase, if any, in the most recent calendar year average and the gross domestic product deflator.
I think whatever that gross domestic product deflator is, that would be the increase.
Representative Nuccio?
Thank you. So I guess, I know you guys don't have it now, unfortunately, but we're experiencing high inflation. I would assume this is going to have a budgetary impact.
Excuse me, Mr. Ayers, I do believe this budget says that it doesn't account for inflationary aspects in fiscal 22 and fiscal 23. Another section of this bill, I thought, said that.
Does it?
Yeah, I think it's.
Do you know?
I don't remember what section it was in.
Would it be underlined?
Oh, right, yeah, it should be, yeah.
While we're looking for that, can you look for that date to see that where that is? While we're looking for that, can you tell me what would happen? Can you tell me what happens to the rate if, for instance, I read the other day that inflation is coming down, right? It's starting to actually soften and come down pretty quickly. In that case, would those rates permanently be adjusted to the rate of increase of inflation? Or would they also deflate? I'm throwing you for a loop. I'm sorry.
Like I said, I haven't worn my Medicaid hat for a long while. I don't want to say either way because I don't want to say it incorrectly. I believe that this is talking an annual increase based on that year's inflation. I don't
Prior
think
year,
there would
right?
be
Yep.
a prior year.
Yeah.
I don't think there would be a negative adjustment unless in some upcoming year, inflation was actually negative.
Okay, so the increase based off of the inflation would be permanent. So in that case, I definitely want to look to see if we're exempting 22 and 23, because I think we have extraordinary inflation that we're already starting to see come down.
And just go back and clarify, an OFA's fiscal note is looking at what language in a bill is changing from whether it increases or decreases cost in a state budget. This is currently the practice in the, from what I understand, currently the practice in the department of basically how they adjust these rates. So the changes in the bill aren't changing anything for the department. It's just clarifying it in statute.
So we're already doing this?
That's my understanding. Prior years.
I didn't, this is all.
Oh, are you all set, Representative Nuccio?
No, I think I need to understand this a little bit better because I just want to make sure that we're not temporarily recognizing an increase that by all means, from every part of the government, federal down, is saying that it's a temporary increase. With that in mind, I know Senator Summers is not here, but she had expressed, oh, this is not for you. Thank you, Neil. Thank you. Senator Summers had expressed concern about this just targeting the nursing home facilities and not looking at expansion of hospital and provider and the negative impact on that also. So, and because this has the, if I'm remembering correctly, and I know we don't have the most current language in front of us, but it's looking at the quality expectation. So if someone is a lower quality and someone is a higher quality, that's why I think it was. Hey,
That's
how'd
the-
you get that?
I had it in my pile. I had to find it.
I didn't get it in my pile. All right, whatever. But so I know she was concerned about this, not just being against the nursing homes and not looking at the overall spectrum of quality of care as a whole. And my last thing on this is, I understand the intent behind this bill wholeheartedly. I think we've all heard some pretty bad horror stories about stuff that's happening in the nursing home arena right now. And I understand that there's really a push to, instead of taking money away from lower quality facilities, incenting higher quality facilities with more money. But my concern with that is that we're going to continue to pay rates for some really horrific quality that we're seeing in nursing homes. And I don't think that that's necessarily the right way to go. I understand why the advocates don't want to see any nursing home rates being reduced at all, under the assumption that if you reduce the rates, you're going to make it harder. But I don't know how else, other than what's in this bill right now, to make sure we're starting to see these nursing homes adequately caring for their residents in a high quality way. So I'm a little torn back and forth on this because I do think there's some numbers that I'd like to understand, especially around the inflation. I'm going to trust that in here, that it has that. I'm going to trust and read whatever, if anybody else has questions, so I can make sure we're not including those 2 years. But I think that's what I have right now, ma'am. Thank you. I might come back though.
Are there any other comments or questions on this bill? Representative Harrison.
Thank you, Madam Chair. There's a previous line on page 12. We talked about this also on page 18. It talks about the commissioner shall determine whether and to what extent a change of ownership shall occasion the rebasing of the facility's rates. Can you please explain what that means? I would think that someone who's buying a facility, is going to be very aware of what the reimbursement rate is, and I'm not sure I fully understand.
I think that what we're trying to do here is to ensure that when someone buys a facility, that they're accurately being compensated for the care that they are given to the constituents or the clients that they have there. And if someone had owned a facility and had not been doing due diligence, this is a mechanism, I do believe, for them to talk with the Department of Social Services and ensure that that rate is being accurately assessed. I think it's more related to the previous owner than it is to the current owner or the potential current owner.
Okay, thank you for that explanation. So that would mean to me then, in all fairness to the new owner who may be doing a better due diligence for care, that the rate would go up, which means that there's not money, if there's no financial impact, that then there's not money in the budget to cover this. Or is there something that I'm missing, or some other place where they would draw money from?
Well, this is a perfect example of when a deficiency bill would fit into the context. As you know, we deal with deficiency bills, but we've been lapsing hundreds of millions of dollars in Medicaid each year. And that on the state side, because we have gotten additional coverage, and Medicaid is such a large component that of the budget that one item like this would not sufficiently impact the state budget.
Okay, thank you for that explanation.
Thank you. Any other comments or questions relative to 1109? Seeing none. Madam Administrator, if we could call the roll on substitute for Senate Bill 1109 JFS LCO 6926.
Senator Austin,
Senator Austin votes in the affirmative.
Representative Walker. Senator Hartley. Representative Exum. Representative Paris. Senator Berthel,
For the purpose of a flag, a no vote today.
Representative Nuccio. Senator Anwar.
Senator Anwar votes yes.
One more time, please.
Anwar votes yes. Senator Anwar votes yes.
Please, could everyone not voting, please mute themselves? Senator Anwar, one more time, please.
Senator Anwar votes yes.
Thank you. Representative Baker,
Representative Baker votes yes.
Representative Belinsky. Representative Callahan. Representative Candelaria. Representative Chaleski,
Representative Chaleski votes no.
Representative Curry. Representative Dathan,
Representative Dathan votes yes.
Representative DiCaprio,
DiCaprio votes no.
Representative Delaney. Representative Delnicki,
Yes.
Representative Dillon,
Yes.
Representative Felipe,
Representative Felipe votes yes.
Senator Flexer. Representative Foncello,
Representative Foncello votes yes.
Representative Garabay,
Garabay votes yes.
Representative Gibson,
Representative Gibson votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes yes.
Representative Gonzalez.
Gonzalez vote yes.
One more time, please.
Gonzalez vote yes.
Thank you. Representative Haddad,
Haddad votes yes.
Representative Hall. Representative Harrison,
Representative Harrison votes no.
Representative Hoxa,
Representative Hoxa votes yes.
Representative Johnson,
Representative Johnson votes yes.
Representative Khanna,
Khanna votes yes.
Representative Kennedy,
Kennedy votes no to flag.
Senator Kushner,
Kushner votes yes.
Senator Lesser,
Lesser, yes.
Senator Marks,
Marks, yes.
Representative McCarty,
Representative McCarty votes yes.
Senator McCory,
Corey's a yes.
Representative Nolan, Representative Porter, Representative Osborne, Representative Reyes,
Representative Reyes in the affirmative, please.
More. I paid off my.
Representative Rosario,
Rosario in the affirmative.
Representative Retigliano,
Yes.
Representative Ryan,
Representative Ryan, yeah.
Representative Sanchez,
Rep Sanchez, yes.
Senator Slapp, Representative Sims,
Representative Sims in the affirmative.
Senator Summers, Representative Terciak,
Yes.
Senator Winfield, Representative Zaustowski,
All set, Madam Administrator?
Yes.
All righty. Up next is Senate Bill number 1199, an act concerning equity in education, JFS to the floor, LCO 6858. I'll entertain a motion for this bill. Moved by Representative Sims, is Senator McCrory, and seconded by
Second.
Representative Sims, and yeah, I'm sorry, I got both sides. Is there any discussion on this bill? Senator Bethel?
Thank you, Madam Chair. I'm wondering if I might direct a question or two to the Senate Chair of the Education Committee.
It's about fiscal matters, yes.
It is. So, Madam Chair, through you to Senator McCrory. First of all, I fully support this legislation as it's before us. I think this is something we've been leading up to over a number of years. When the Senator and I have served on the Education Committee, we've worked in earnest to bring forth bills that increase minority teacher recruitment. And I think we're at this point today with this piece of legislation as kind of a culmination of that, and now taking it to the next step to actually bring more minority teachers into our public school education system. I'd just like to ask a question or two regarding the scholarship program that is outlined in this bill beginning around line 114, section 4. So, Madam Chair, through you to the good senator, do we have any estimate as to how many students might be participating in that program? Or participants, through you, Madam Chair?
Thank you, Senator. Senator McCrory, do you have an answer for this particular question, sir?
Yeah, absolutely. Actually having a conversation with Terrence Chang and others, we're looking like initially starting off this program approximately about 20 students.
Can you talk up, sir? I know.
Approximately about 20 students initially when we get started, because we know it takes time for things like this to roll out. But when this is up and running fully, I expected about at least 60 students per year to take part in a program like this. Through you, Madam President.
Thank you very much. Senator Bethel.
Thank you. And I was having a little trouble hearing the good senator. I believe he said 20 students to start and up to 60 per year.
That's what he said, sir.
Okay, thank you.
Sure, on the Senate.
We have some work to do on.
Oh, sorry.
No, keep going.
Thank you. And Madam Chair, actually, I can ask this question to you, Madam Chair. The maximum grant shall not exceed $20,000 per year per student?
Yes, sir.
Okay.
Through you, Madam President. Yes, through you, Madam
Thank you.
Okay, and through you, Madam Chair, to the good senator, the payments for these scholarships are made to the student, or they are made to the programs in which they are enrolled? Through you.
Senator McCrory.
The idea is to have the scholarships made to the university. And one of the good things about this program, we're trying to collaborate with our state schools. So therefore we have a cohort. We're looking to have a cohort of students at each one of our state universities, not the UConn, but Central, Southern, and have a co-op of students working together hand in hand and with collaboration with the school districts, so that when they come through this program, they have support at the state university and also working collaboratively in the school districts from their freshman year. So basically, the school districts will be working with these kids from the time they're freshmen in college all the way through the program when they graduate and have an opportunity to work in school districts when they graduate. So that's the idea of it. And also the idea behind it is to have them commit to doing at least 3 years of service in the state of Connecticut once they complete the program. Through you, Madam.
Thank you. Senator Bethel.
Thank you, Madam Chair. The good senator anticipated my next couple of questions, so I'll stop here, and I know some other members have questions for probably for the good senator. Thank you.
Thank you. Representative Bonicello.
Thank you, Madam Chair. Under 1199, it appears, as was said earlier, that a teacher who receives a scholarship is required to serve 3 years in order to repay the scholarship. Does the teacher have to teach in the same school system, or can the teacher teach in multiple school systems in Connecticut in order to get that repayment requirement met?
Senator McCrory.
Through you, Madam Chair, absolutely. They're not required to teach in any one school system, but they are required to teach for 3 years in a state Connecticut public school system. Through you, Madam Chair.
Senator Bonicello, did you hear him?
I did, thank you. I have
Okay.
another question.
Go ahead, sir.
Okay. I found a definition for minority in the statutes, but nothing pertaining to diversity. All right, having said that, it says that the state is collecting annual data on race and ethnicity of the teachers. What's not clear is that what is the goal regarding the diversity that this bill seeks? How do local boards of education know whether or not they've reached a goal, which is not defined? And then just one more add-on to that, adjunct instructors are mentioned in here. Do they count towards the diversity goal or not?
Senator
you.
McCrory.
Yeah, I think the state currently has a goal in mind where they would like school districts to be in as far as their diversity of teachers. And this program actually will, when it's up and running after 2 years, will create, after 4 years, you think about, we will produce more teachers, more diverse teachers than any of our state universities combined. So therefore, there's a great opportunity to diversify all school districts. That's why no one is required to work in one particular school district. So we're giving the individuals, the students who are coming through this program, opportunity. We're providing a scholarship for them and also provide them opportunities to experience and work in multiple school districts at the same time. And the idea is for them to go back and choose and work in one for 3 years. And the idea around, I think the adjunct professors, I don't believe currently an adjunct professor, if we do this certification, will be considered. I'm not quite sure on that. Honestly, I don't want to tell you something and not be true. So I'm not quite sure if the adjunct professor will be counted towards the diversity level count in the state of Connecticut. Through you, Madam Chair.
Thank you. Representative Bonicello.
All right, thank you, Madam Chair. That's
Are
it.
you all set?
Yes,
Representative
thank
McCarty.
Thank you very much, Madam Chair. And before I begin, I just would like to align my comments that this has been a very high priority within the Education Committee and all of the education stakeholders, that we absolutely have to have more diversity in our teaching cadre in the schools. But to the good Chair of Education, if you wouldn't mind commenting, please, some of the recipients that receive the scholarships, there's 2 different avenues that they would have to repay back the funding from the scholarship. There are conditions that are set. Would you please comment on those? And then I do have one other comment.
Yep.
Senator McCrory.
Yeah, absolutely. So the idea is to grab these students right after their freshman year when they have not decided a major and provide them scholarships from a sophomore, junior, and senior year. The caveat to that is if we give you the scholarship and you graduate from the university and you choose not to go back, not go into the school education, you will have to pay that scholarship back. But you would not have to pay that scholarship back again if you do commit to doing at least 3 years of service in a traditional or within a public school in the state of Connecticut. Through you, Madam Chair.
Representative McCarty.
And I believe there's another reduction that they would pay back 50% if they only did the 2 year. Is that correct?
Through you,
Yeah.
Madam Chair, absolutely. If they only
Yeah.
do 2 years, there's a gradual reduction in what they have to pay for through the scholarship. Through you, Madam Chair.
Representative McCarty.
Yes, thank you very much. And then there are 2 other bills that were incorporated into this bill. And if I may, just so that people are clear, we do have it already in progress, a model school curriculum that has been ongoing for the last few years, and 2 new components were put into it on cursive writing and world languages. I know you're smiling. But could you just please let the committee know, is this a mandate, and would this be a mandate on our school boards, or is there flexibility there? And if you wouldn't mind commenting on that provision.
Senator McCrory.
Of course I'll comment on that, but even though it ain't got a darn thing to do with money, but I'll comment. But honestly, what we're looking to do is not a mandate. This model curriculum is a curriculum that's going to be created by a state board of education that will incorporate, again, in cursive writing. 'Cause unfortunately, many of our young people nowadays, anyone under the age of 23, have not been taught how to write in cursive in the state of Connecticut, which is very unfortunate. They will never be able to read the Constitution that they live by. So what we want to do in this model curriculum, make sure that our students are taught how to write in cursive and also taught how to learn a second language at a very early age. All the research shows that if you want to teach a child a different language or bring anything to them, the best time to do that is when they're very, very early and young, and not when they're junior in high school, want to learn how to speak French and English. If you want to teach them and want to learn it for a lifetime, you start providing that in the early grades. Through you, Madam President. Chair.
Representative McCarty.
I thank you very much. I don't know whether I'm limited to 2 questions.
You are beyond that, but you were beyond that a question or two ago, but
All right, I'll stop for the moment and come back if you allow me.
I'm hoping you don't have to come back now. Are there any other questions relative to this bill? Who is it? Representative Harrison, followed by Representative Chaleski.
Thank you, Madam Chair. I can get back to where I was on page 2, or even starting in page 1. It talks about paying students for an amount of $7,500 for their teaching experience and a stipend. I think the way I read this to the teacher who supervises them of $5,000. Can you explain what this is for and how many students you think will participate in this?
Yeah.
Senator McCrory.
Yeah, through you, Madam Chair. So they're paying for the teacher experiences when they're doing the student teaching. What we're finding now in our state schools is so many of our students are having a very difficult time when they have to do their practicum, actually do the students teaching. We found that many of them cannot afford to continue to go to school and take that much time off out there a whole year to do their student teaching. They just can't afford it. So what we want to do is build in a mechanism where that we will actually compensate them for the time they spend as a student teacher. Basically, they're in the class, they're in the school all day. They're in school all day. And I think that we should compensate them. And also for the support teacher, we also have a teacher, we want to pay them a stipend up to $5,000 so they can help mentor that potential teacher through the pipeline. And I think that's a great investment to make sure that we can, what we find so often, especially with the diverse teaching population, so far, it's so difficult for them to navigate the systems, whether at the college level or at the school district level. So what we found that if we put a veteran teacher working with them to help them navigate what's going on at the academic level, at the school, and in the school district, we found that that's a good investment. Through you, Madam Chairwoman. And again, initially we're looking to service about 20 students, I believe. But when this program is up and running fully, approximately about 60 students we'd like to see when we go on at a full rate. Through you, Madam Chairwoman.
Representative Harrison, does that answer your question, ma'am?
And can I ask him to repeat the end? I didn't hear. I think he said 20 students, but in reality, didn't hear.
No. So
Senator McCrory.
So at the end, I said,
I don't think your mic is working very well.
no, I'm just not passionate today. So I always hear that word. He's so passionate about it. I want you to hear my passion. I want you to hear what I'm saying. So today I'm not going to be passionate. I'm just going to say what I have to say. So initially, the program is looking, when we pilot, approximately 20 students. But by the second year, it looked like we want to have approximately 60 students in the program. Through you, Madam Chairwoman.
Representative Harrison, did that answer your question?
So the next question I have is, has any of this been included in the budget?
Senator McCrory.
Absolutely.
Representative Harrison.
I think according to what I see from OFA, it has not been included in the budget.
Well, through you, Madam Chair, you know, OFA could be wrong at times, but if it's not included in the budget, I look to make this a working process. And as we get to the final line, I am encouraging our leadership and the members of this committee to make sure it does get on board, because that's how important it is. We have to be very intentional about what we're doing. We've been trying to diversify our teaching population for the last 16 years, and we have been unsuccessful. I think this program will go a long way in filling the needs that our state need for diverse teaching population. And I will do it is my intention to make sure the funds are available for this program. I don't think it's a lot of money. I think it's approximately $6 million in 1 year. And I think we said, well, not even $6 million first year, because we know we can't roll out officially, but it's about $3 million investment the first year and a $9 million investment in the second year. Through you, Madam Chairwoman.
Thank you, sir. Representative Harrison, does that answer your question?
So my final question is this program something that is over and above what would normally happen to someone who's looking to do their student teaching experience?
Senator McCrory?
Yeah, this program is not, we have never done anything like this before in the state of Connecticut. We have never done anything intentional like this. And we never have, we've put money out there, but we've never been intentional about making sure those students get across the finish line. I think this program has enough attributes built into it where it can take young people from their sophomore years in college, providing the support systems in place and the resources to service them while they're in college, and also help them when they're finished their program, place them in school districts, diverse school districts across the state of Connecticut. So this is something that has never been done before, but it could be a pilot, not just for the state of Connecticut, for all states, because all our states in the United States are having a problem in regards to diversifying our teaching population, but yet even getting people to go into the fields of education. If you look at the numbers right now, people are not going to the field of education. A lot of it is due to what they experienced over COVID-19, but a lot is also due to the fact that, you know, the profession is getting beat down because of the experiences that a lot of teachers are having. So what we want to do is we want to highlight this profession and encourage young people, especially people who normally go to college and don't know exactly what they want to do. We feel as though we put a bone in front of them and say, hey, if you follow with us and work with us and become an educator, we'll pay that way. So again, no one's doing this in the state of Connecticut. It's called growing your own. And I think we heard that terminology so often in the state of Connecticut, but it's just words. In this case, we're putting words to action. Through you, Madam Chair.
Representative Harrison, does that answer all your questions?
Not in full, Madam Chair. Thank you. I do have another question. How will we develop metrics around this so, you know, we can determine who would get this? And I'm going to assume it's a grant, or is it a scholarship?
Senator McCrory?
I'll say it's a forgivable grant / scholarship. The metrics, that's a very good question. I didn't get into the details about the metrics, but I will make sure, my goal again is to make sure these young people graduate from this program. And I think the final metric would be how many more teachers have we put in our state of Connecticut that are diverse. That's what the metric would be. If we start out with 20, and if we get 12, I think that's great, because currently right now, so many students who start out, especially students from diverse backgrounds, especially students who coming from low resource communities who do not have all the probably academic abilities at a low level. If we can get 60% of these young people to graduate and stay with us, that's outstanding, because right now we're doing about a 20 or 30% turnover rate. Through you, Madam Chairwoman.
Thank you. All set, Representative Harrison, beyond the 2 questions or 3 or 4?
Thank you, Madam. I'll continue to listen to the
5.
discussion, and I'll let you know if I have some more. Thank you.
Representative Chaleski?
Thank you, Madam Chair. And I just want to take the opportunity to give accolades to the leadership of the Education Committee, which I had the pleasure of working on this bill that's before us today. Equity in education is certainly something that is important to me, important in all aspects of education. Coming from the most diverse city in the state, as you've heard me say before, and one of the most diverse in our country, this is something we constantly struggle with, to recruit teacher diversity, so that, you know, just like when you cannot teach a hungry child, you can't teach a child you cannot connect with or see yourself through. So this is something that's so important to me. I was proud to support it in the education committee. I will be supporting it today. I did have a question about section 3, and just please let me know if I'm wrong in my understanding, but a Board of Ed will submit the increasing education diversity plans subsection. Failure to comply with will result in withholding a sum that is yet to be determined? Or
Senator
can you
McCrory.
clarify that through you, Madam Chair?
I didn't, okay, if that's in there, we'll have to look at that, because I don't want to, the reality is you have to post, school districts are required to post the diversity plans on the website. And unfortunately, in some cases, for whatever reason, they're not doing that. I want to encourage them. I don't want to penalize them. So if we have to take that part out, whereas we're taking resources away from them because they didn't do it, again, I don't want to beat them over the head. I don't want anyone to lose their resources, but I do want communities and people who decide to go into a school district or live in a community to know what diversity levels looks like in their schools. So we just want to, it's a way of trying to encourage school districts to post their plans, not necessarily trying to beat them over the head if they don't reach them. Through you, Madam Chair.
Representative Chaleski.
Thank
Are
you,
you all
Madam
set?
Chair. Just another question. I understand that cursive and world language is not required. It's not a mandate of the school districts. And I fully support those additions. But again, like I said in the education committee, my caution is that when you put the world language piece up in the model curriculum, that you open the door for the school districts that can hire world language teachers to do so when it's so difficult to find them now for the districts that, it's requirement for graduation, and we struggle just for our high school students. So that's my other just caution. I fully support it. My kids were exposed to world language from the very beginning. So that's my only comment about that. Thank you, Madam Chair.
Thank you. Representative Hoxa.
Thank you, Madam Chair. So my first question is, in section 4 of the substitute language on line 113, minority, the word minority is taken out, and diverse students, this term that we've been, using for the last few minutes here. And further down, it attempts to define the term diverse and diverse student, I guess, or diverse teacher. But I still can't really quite find a clear definition of it. Could somebody please kind of give me a clear definition of what diverse means in this context?
Representative Hoxa, is your question relative to the term diverse? Is that what it's relative to?
Yes, correct, Madam Chair, because it all boils down to the kind of universe of candidates for this program, and that deals that it inevitably affects funding and the amount of money that we're putting towards the program. Through you, Madam Chair.
Senator McCrory.
Through you, Madam Chair, I believe basically what was turning, whatever you use the word minority in the sense of the state of Connecticut, what's the legal term? We just changed it to diverse teaching population. So whatever legal term, and I think you probably get a lawyer, one of these rich lawyers here to explain to us what's the definition of minority that we use in the state of Connecticut. It's the same definition. Whatever definition we was using before to use minority, we just call it diverse teaching population. Through you, Madam Chair.
Representative Hoxa.
Okay, I think that helped me understand. So correct me if I'm wrong. A diverse person would not be someone that is, let's say, Caucasian, but from a foreign country where English is not a native language. That would not be someone that's diverse and thus not a good candidate for this program.
Senator McCrory.
Again, I'm not a lawyer. Whatever term that whoever was defined as a minority is still defined as a minority in the state of Connecticut. Again, like for this particular program or this concept where we're doing the diversified teacher population, we're just using diverse teacher population instead of the word minority. The meanings are still the same, and the identity of who they are legally, federally, and statewide will always still be the same. Through you, Madam Chair.
Representative Hoxa.
Thank you, Madam Chair. A second question, if I may, through you, Madam Chair. Again, in section 4, lines 123, or no, I'm sorry, section 4, lines 157 and 162, talks about a situation where if an individual goes through this program and has been employed, you know, for 3 consecutive years, immediately following graduation from a teacher preparation program, such recipient shall not be obligated to repay any portion of the amount of the scholarship received by such recipient. So during this 3-year period, are we measuring by the day, by the week, by the month? Are we taking into account situations where maybe said person goes away on maternity leave or paternity leave, or has some sort of medical issue and is not able to go into work? Or is the clock still running in those instances? Through you, Madam Chair.
Thank you. Senator McCrory.
Yeah, through you, Madam Chair, a 3-year commitment is required. During that 3-year commitment, if someone gets pregnant, someone gets sick, the clock is still ticking, and we still need 3 years out of you. Whether we get that 3 years over a 4-year period, we need that 3 years in order for you to not have to be paid that forgivable loan / scholarship. Through you, Madam Chair.
Thank you. Representative Hoxa.
Thank you, Madam Chair, and through you, I think I understand. So what the good senator explained was that when we're talking 3 years, that means 3 years of service as an educator, as a teacher. But if that 3 years of service takes longer than 3 years to actually complete because of the various, things that could happen in one's life, then we'll still give them an opportunity to complete the requirements, the 3-year requirement past the 3-year mark. Through you, Madam Chair, is my characterization of what the good senator said correct?
Senator McCrory.
Absolutely. Through you, Madam Chair, you explained it very well. We require 3 years of service. In some cases, just like in college, some people graduate in 4 years, some people take 6 years. We are looking for 3 years of service once you complete teacher prep program. Through you, Madam Chair.
Representative Hoxa, you're beyond your 2-question limit. Where are we now? What are we doing?
We are all set. Thank you, Madam Chair.
Thank you. Representative Delnicki.
Thank you, Madam Chair, and through you to the good proponent. And I hope I hear the enthusiastic voice when I ask the
I hope
question
not, so let's move along.
and get the answer. In line 358, do we have the funding and expertise to staff the world language K through 12? Because that's really critical when you think about it. Through you, Madam Chair.
Senator McCrory.
Yeah, through you, Madam Chair. We do not. We do not have enough teachers who can teach the world language in the state of Connecticut, and we're well aware of that. And that's why I know the question was asked earlier from the good rep from Danbury, making this a mandate. We remember the model curriculum is just a model curriculum. It's not a mandate. It's just an example of what school districts can use, and what we're putting in there is what we feel as though it's best for our students. But we all know that we have a problem identifying and recruiting teachers who can teach world languages. So again, it's not a mandate. And one of the things we're looking to do with this particular program, if you think about it, if we're recruiting a diverse teaching population, I will suggest, will recommend, or expect that a number of them will come from communities where English is a second language for them. So therefore, we're knocking out two birds with one stone by putting students in this program and asking them to do their service for 3 years afterwards. The idea is to be able to identify them and also identify those who can teach a second language. Through you, Madam Chair.
Representative Del Nicky, does that answer your question, sir?
It answers that question, but I have a couple of additional questions.
A couple, you only have two, sir.
Oh, I've got 2.5. How about 2.5
That's
questions?
killing me today.
I'll be brief with my answer.
With
Go ahead,
kindness.
sir.
Thank you, Madam Chair. In section 12, how many positions remain unfilled for the purpose of administering? And I love this title, Aspiring Education Diversity Scholarship Program.
Senator McCrory,
I didn't, can you ask the, I didn't.
can you repeat
Yeah.
the question, sir?
I'll repeat the question. In section 12, how many positions remain unfilled for the purpose of administering the Aspiring Education Diversity Scholarship Program? And I love that title, that name of that program.
Senator McCrory, are there any empty positions in SDE?
Yeah. Are there? Absolutely. A number of them. There's, yes, through you,
There's a
Madam Chair,
lot.
there's a number of positions at SDE that really needs to be filled, especially if we're asking them to do all the work that we've been asking them to do over the last few years. Unfortunately, they're short-staffed, and what this piece of legislation doing is really getting our state to hire people to do the work that needs to be done at SDE. Through you, Madam Chair.
Representative Del Nicky, you're on two. Now, is this a half?
This is the half question.
Okay.
Are there any currently unfilled positions that could be utilized? Part-time employed higher education teachers that could fill into any of those positions that we've been talking about that remain unfilled, that could be filled in some fashion? Through you, Madam Chair.
Senator McCrory, are there any people out in the world that could help out here?
I'm sure
This
they
is
are.
advertised.
And if SDE advertise, I'm sure they can find it. And I'm sure they have some people in-house that they can utilize, but that costs money. And we need money, and they need money so they can fill these positions. And that's why we're the appropriation committee, to ask and beg for money so we can get things done at SDE.
Thank you.
Madam Chair.
Representative Del Nicky, are you going beyond 2.5?
Well, all right, I won't go to 2 3/4.
Thank you.
I was close there.
I know.
2 3/4. I do thank the good senator for his responses there. And I do thank you, Madam Chair, for the opportunity to ask a few questions and make a few positive comments. And for the record, I'm glad to see cursive, because that's a lost art, an art that people just don't.
Representative
No.
McCarty, do you have any questions?
Thank you very much, Madam Chair, and I appreciate you recognizing me again.
For the second time?
Well, I find this to be a very serious matter, and I would like to make a comment because I know there was a lot of confusion about a portion of the bill near the end, and I know the good senator and I've worked on this on lines 406 through 409, Senator. There's confusion about what we were talking about with the LEAP program and the credit recovery piece. It isn't meant, and tell me if I have this correct, we talked about this because we know with the pandemic, we had an awful lot of issues with attendance. And the effort here is to ensure that our students that come back to school and that we do all we can with these various programs to help them meet the education requirements so that they meet those attendance parameters. But it's not necessarily saying that if you're part of the LEAP program, that you meet a graduation requirement. So I know there was some confusion about that. We're trying to add the programs to help those students meet the attendance requirements so that they can meet the graduation requirement. Is that correct? And would you comment on that?
Senator McCrory,
I don't think I need to comment. What you said is absolutely true. This is what we're trying to do. Because of COVID, we saw that so many students miss school. And what we want to do is put programs out there so they can make up the time that they missed because of COVID, so they'll be eligible to graduate. And we want to be careful about that, because we just don't want to graduate anyone because they spend time in school. We want to make sure they are prepared academically. And that's why we want to put the programs in place so they'll be able to get the knowledge base that they need to be a a graduate of a public school in Connecticut. Through you, Madam Chair.
Thank you.
Thank you very much. And then if I, just saying this 2-second comment, that I think we may want to look at the language there because it became very confusing to a number of people. They thought we were substituting that for a requirement for high school graduation. Thank you. Thank you very much, Madam Chair.
Thank you. Up next is the number. Oh, I'm sorry. Are we gonna vote?
You got to vote.
Okay.
Give her another soda.
Representative Nuccio, do you have another question?
I do, and yes, so. And so does Representative DiCaprio, but, okay. Yes. I have a couple of questions. I just would like some clarifying information on, the $10,000, is there a max on that? Is it per year while they're in school, or is it when they get out of school and they start teaching? Through you, ma'am.
Senator McCrory?
Yes, it's $10,000 a year while they're in school, while they're undergrad. Yes, through you, Madam Chair.
Representative Nuccio?
Is there a maximum on that, or is it just, is it $40,000 maximum then? The assumption that it's just a bachelor's and not the 6-year through you, ma'am?
Senator McCrory?
Yes, absolutely. It's just for undergraduate degree right now. Through you, Madam Chair.
Representative Nuccio?
Thank you. And then in the portion of the bill that is talked about recapturing, if somebody leaves, they have to repay 100% of the scholarship received. What is the mechanism for recovering those dollars through you, ma'am?
Senator McCrory?
They're gonna get a bill. No, through you, Madam. Through you, Madam Chair, the mechanism will be actually some, I'm not that granular into this right yet, but the idea is to let them know ahead of time. You're making when you accept this money, you're making a commitment to complete this program. And if not, the money is on the books and we'll find a way. I'm not sure yet. Again, the work in progress, but they will be required to pay that money back if they do not fulfill the requirements of teaching 3 years in a public school. Through you, Madam Chair.
Representative Nuccio?
Thank you. I'm a little concerned that it's a to be determined how we would recapture it. Just because this is a lot of structure in this bill, and I would like to kind of see the whole thing fleshed out. And in regards, I want to go back briefly to something that I think this bill could use from a clarity perspective. You had mentioned that you changed the word minority for diversity. And the concern that I have around that, it's a conversation I had with somebody else before who liked to just use the word equity. But when I asked, what does that mean? Like specifically, what does that mean? Equity means something different to you than it does for me. And I think from this perspective, diversity, I think of teaching, it's mainly a majority female field. So would any male be considered part of diversity? Because you had specifically said the diversity levels, that we needed to work on the diversity levels in people's schools. So is that diversity of their own population, diversity of the entire state's population? Like, I think the word is, there's probably close to 100 different diversity lines in here that's underlined as a change, but I really don't see a strong definition of how you are going to label or what is the eligibility criteria for this? Who applies, who doesn't apply? So that's just a suggestion. I think that we really kind of need to firm up more specific parameters of what you want to see, because I absolutely agree we need more minority teachers, but minority teachers makes more sense to me than a diversity teacher. It's just more vague in that essence. So I think that's something that maybe we should look at firming up. The stipend that you mentioned for the teaching apprentices, I want to say, like they're in-service clinicals, is that going to be something that is going to be paid by SDE, or is that going to be something like the stipend for the learning teacher? Is that going to have to be filtered into the BOE budget at a municipal level through you, ma'am?
Senator McCrory?
Well, two things. I want to go back to the question around diversity. I think you're right. Again, we were just changing the word minority to a diversity population. But in regards to education, you're right, because diversity means different things. I honestly believe eventually we want to get to the point that We know in our elementary schools, there's virtually no men. There's absolutely no men. It's very rarely. So what I want to do eventually get to a point where we can actually go out and recruit and find men, regardless of what their ethnic background look like, to teach in our elementary school. So that's the first part. I agree with you on that. The second part in regards to the stipend will be for once these individuals are actually doing their student teaching. And what we found that they just can't afford to do student teaching and also pay for their way through school. It's just virtually impossible. So what we want to do is put resources in place from the SDE. It'll be from SDE. That's a conversation or commitment between SDE and the local university or college that they're working with. Through you, Madam Chair.
Representative Nuccio.
Thank you, Madam Chair. I'm glad you got that point. That's like specifically what I mean. Like having men in elementary schools is extremely important, especially for young boys who are in just single mom households. If they have male teachers, that starts that whole, almost like the father initiative. And we're missing that in the elementary schools, which is why specifically I'm concerned about the use of just diversity or minority here. I think we really need to, as you said, look at the makeups of our schools at a local level and how we're creating an environment where we've got resources and people around that help the growth of kids. So I would be very happy to, at any point, talk about this and try to find a way to better solution it. I think it's a good initiative, but I think it just needs a couple of tweaks here and there. And I don't say that disrespectfully, because I know you guys have been working on this a long time, but as someone coming in with new eyes, I would hope that, we could talk about that.
All set?
Yes.
All set?
I think very.
Okay. All
Let's
set?
vote.
No,
Let's vote.
no,
Let's vote. But I think
no.
you're.
I got people that have questions.
Really?
I don't have time. We're not going back and forth. No more with Senator McCrory. You all got his answers. So any other answers are going to come from me. So if you're thinking you're going to talk to him, you are wrong. So we are going to Representative DiCaprio. Go. You've got 2 questions and that's it.
Thank you, Madam Chair. I only have one question.
Okay, good. What is it? You will not.
Just if someone can just, due to my ignorance on this subject, can someone just go through the overall process of the scholarship program as it's talks about in section 3, particularly aspiring educator and diversity program?
I'm sorry, we're not going to go through the whole scholarship program because it doesn't.
Can someone give me a brief overview of
No.
that, what that is, and
No, I
how
cannot.
basically how candidates are selected for that?
No, I'm sorry, sir. This is a budgetary issue and I've had given a great amount of latitude to this issue, but we've had 10 people ask questions about things that have no relevance to the budget part of this, of this bill. Budget part of this allows the scholarship program to exist and provides an amount of up to $10,000. But how it works is a question for the Education Committee, not the Appropriations Committee. I am sorry, sir, but I've reached my level of it becoming slightly intolerant. So I apologize, but.
Thank you, Madam Chair.
Thank you very much, Representative Tigliano. A budget question, sir.
Thank you, Madam.
Number 2.
Well, it may not be a budget question, but it's a money question. I was just curious what happens if they do not pay the money back?
Well, what happens if you don't pay the money back to your electric bill? What happens if you don't pay the money back for your rent? Somebody comes and they attach your finances. If you have no finance, it doesn't get paid back.
Can this debt be dispensed through bankruptcy?
Anything can, almost anything can be,
Well,
almost anything.
Traditional student loan debt cannot. That's why I asked the question.
Right, and it's not traditional relative to that.
So when the payment goes out, does it go directly to the student or to the school?
To the school.
So
That
the
was
school
answered
is the one
earlier.
who receives the money, not the student.
Correct. Relative to that, helps them out. Anybody else? Seeing none, Harris, Mr. Representative Harrison, you are up for like the 3rd or 4th time. Maybe the 2nd.
Only second on this one.
Okay,
And these are budget questions, Madam Chair. So there is section 14, 15, 16, 17, 18, and 19. It looks on the report that we got from OFA that those were not addressed, and there's a lot of money sitting there. So could you just please elaborate?
Is that not the
we took out that's in the JF language. When you look on your
just so you know, when you look on your computers, you don't see the JFS language. We took all the sum of out. We removed all. the
So
sum
all
of.
those sections have been
Yeah,
removed?
They were removed.
Okay, thank you for that.
Yeah, because we can't have them appropriate money in a bill. Okay. Anybody else besides Representative Harrison? Oh, you have an amendment, sir? Yep. We're gonna call the vote. Huh? No, go ahead. Let's go. Okay, there's an amendment on the floor.
I'm sure we have an amendment, through you.
Okay. Can you say what it is?
I could summarize the amendment by saying that, the amendment says in chapter 163 of the general statute, we're amending that anytime a Board of Education or the State Board of Education adopts new curriculum guidelines and materials that they must include a public comment period for all new developed curriculum guides, materials, and under consideration by the State Board of Education, submission of such curriculum guides and materials to the Joint Standing Committee of the General Assembly having cognizance of the matters related to education for their approval following the public hearing process, such curriculum guidelines and materials by such committee prior to the adoption and implementation of such curriculum. Basically, Madam, it's a transparency bill that whenever a local or state board of education adopts new curriculum or curriculum guides, they do so with public comment.
Thank you. Is there a second on that amendment?
I move adoption.
Second.
Seconded by Senator Berthel. Discussion, seeing no discussion, Madam Administrator, we're voting on the amendment, and I urge all my colleagues to vote no.
Senator Austin,
Senator Austin votes negative.
Representative Walker,
Representative Walker votes negative.
Senator Hartley, Representative Exum,
Representative Exum votes no.
Representative Paris,
Paris votes no.
Senator Berthel,
Yes.
Representative Nuccio,
Yes.
Senator Anwar, Representative Baker, Representative Belinsky, Representative Callahan, Representative Candelaria, Representative Chaleski,
Yes.
Representative Curry,
No.
Representative Dathan,
No?
and thank you, ma'am.
Did you hear me? Sorry.
Gotcha. Thank you.
Thank you.
Representative DiCaprio,
Caprio's yes.
Representative Delaney,
Representative Delaney votes no.
Representative Delnicki,
Yes.
Representative Dillon,
No.
Representative Felipe.
No.
One more time, please, sir, so I can see you.
Representative Felipe votes no.
Thank you, sir. Senator Flexer. Representative Foncello,
Representative Foncello votes yes.
Representative Garabay,
Representative Garabay votes no.
Representative Gibson,
Representative Gibson votes no.
Representative Gilchrist,
Representative Gilchrist votes no.
Senator Gordon,
Senator Gordon votes yes.
Representative Gonzalez,
Gonzalez vote no.
Representative Haddad,
Haddad votes no.
Representative Hall,
Representative Hall votes no.
Representative Harrison,
Representative Harrison votes yes.
Representative Hoxa,
Representative Hoxa votes yes.
Representative Johnson,
Representative Johnson votes no.
Representative Khanna.
Representative Khanna votes no.
One more time so I can see you.
Representative Khanna votes no.
Thank you, ma'am. Representative Kennedy, Kennedy votes yes. Senator Kushner,
Kushner, yes. No, I'm sorry. Excuse me. I get so used to yes.
Senator Lesser, Senator Marks,
Marks votes no.
Representative McCarty,
Representative McCarty votes yes.
Senator McCrory,
Poison no.
Representative Nolan, Representative Porter, Representative Osborne,
Osborne votes no.
Representative Reyes,
Representative Reyes votes no.
Representative Rosario,
Rosario votes no.
Representative Retigliano,
Yes.
Representative Ryan,
Senator Ryan votes no.
Representative Sanchez,
Sanchez, no.
Senator Slapp,
Senator Slapp votes no.
Representative Sims,
Representative Sims votes no.
Senator Summers, Representative Tursiak,
No.
Senator Winfield, Representative Zawistowski.
Madam Administrator, Senator Anwar votes no.
Thank you, sir.
Madam, come on, guys.
Representative Baker votes no.
Representative Baker, thank you, sir. Anyone else who would like to cast their vote who has not yet done so?
Madam Administrator.
Total number voting 44, those voting yea 12, those voting nay 32, those abstaining 0, those absent outvoting 9.
The amendment fails. Are there any other questions on this one for the first time only? All righty, gonna vote on the bill itself. We're gonna vote on substitute for Senate Bill number 1199, JFS to the floor, LCO 6858. Madam Administrator.
Senator Austin,
Senator Austin votes in the affirmative.
Representative Walker, Senator Hartley, Representative Exum,
Representative Exum votes yes.
Representative Paris,
Paris is a yes.
Senator Berthel,
Berthel, yes.
Representative Nuccio,
Representative Nuccio is a no with the intent of working on this with Senator McQuarrie.
Senator Anwar,
Senator Anwar votes yes.
Representative Baker, Representative Baker, Representative Belinsky, Representative Callahan, Representative Candelaria, Representative Chaleski,
Representative Chaleski votes yes.
Representative Curry,
Yes.
Representative Dathan,
Representative Dayton votes yes.
Representative DiCaprio,
Caprio votes no.
Representative Delaney,
Representative Delaney votes yes.
Yes.
Representative Dillon,
Yes.
Representative Felipe,
Yes.
Senator Flexer, Representative Fonsello,
Representative Fonsello votes yes.
Representative Garabay,
Garabay votes yes.
Representative Gibson, Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon.
Senator Gordon votes yes.
One more time so I can see your audio, please, sir.
Senator Gordon votes yes.
Representative Gonzalez.
Yes.
Up, one more time, please, ma'am.
Representative Gonzalez vote yes.
Thank you, ma'am.
Thank you.
Representative Haddad.
Haddad votes yes.
Representative Hall.
Representative Hall votes yes.
One more time for me, please.
Representative Hall votes yes.
Thank you, sir. Representative Harrison.
Representative Harrison is no.
Representative Hoxa.
Representative Hoxa is a no.
Representative Johnson.
Representative Johnson votes yes.
Representative Khanna.
Representative Khanna votes yes.
Representative Kennedy.
Kennedy votes yes.
Senator Kushner.
Yes.
Senator Lesser.
Senator Marks,
Marks votes yes.
Representative McCarty,
Representative McCarty votes yes.
Senator McCrory, Representative Nolan, Representative Porter, Representative Osborne,
Osborne votes yes.
Representative Reyes,
Representative Reyes in the affirmative.
Representative Rosario.
Rosario in the affirmative.
One more time for me.
Representative Rosario in the affirmative.
Thank you, sir. Representative Retigliano,
No.
Representative Ryan,
Votes yes.
Representative Sanchez,
Rep. Sanchez, yes.
Senator Slapp,
Senator Slapp votes yes.
Representative Sims, Senator Summers, Representative Tursiak,
Yes.
Senator Winfield, Representative Zawistowski.
Madam Administrator,
Yes, Representative Gibson.
thank you so much. Representative Gibson votes yes.
Thank you, sir. Representative
Thank you.
Baker,
Representative Baker votes yes.
thank you, sir.
Thank you. Up next is going to be item number 12, House Bill number 6616, JFS LCO 6932, an act concerning expansion of Husky health benefits to those ineligible due to immigration status. And this is in the budget. I'll entertain a motion. Moved by Representative Walker, seconded by Senator Lesser. Any discussion? Representative Harrison.
Thank you, Madam Chair. I understand that this is in the budget, but can you explain the percentage, or if this will mean that we have to add additional state dollars because we will not be getting a federal reimbursement for it?
We will be adding $3 million. That's in the budget already in the second year to change the current process from 12 to 15 years of age for those regardless of immigration status receiving Husky B.
So we will increase it from 12 to 15 years of age for the next biennium budget. And the state needs to cover that cost. There will not be a federal reimbursement for that.
Correct. The federal government does not fund for workers or people that are undocumented.
Thank you for that answer.
Any other questions? Seeing none, Madam Administrator.
Senator Austin,
Senator Austin votes in the affirmative.
Representative Walker, Senator Hartley, Representative Exum,
Representative Exum votes yes.
Representative Paris,
Paris, yes.
Senator Berthel,
No.
Representative Nuccio,
Representative Nuccio is a no.
Senator Anwar,
Senator Anwar votes yes.
Representative Baker,
Representative Baker votes yes.
Representative Belinsky, Representative Callahan, Representative Candelaria, Representative Chaleski,
Representative Chaleski votes yes.
Representative Curry,
Yes.
Representative Dathan.
Yes. Representative Dathan votes yes.
Thank you. Representative DiCaprio,
Caprio's no.
Representative Delaney,
Representative Delaney votes yes.
Representative Delnicki,
No.
Representative Dillon,
Yes.
Representative Felipe, Representative Felipe, Senator Flexer, Representative Fonsello,
Representative Fonsello votes no.
Representative Garabay,
Garabay votes yes.
Representative Gibson,
Representative Gibson votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon, Senator Gordon,
Representative Gonzalez,
Gonzalez vote yes.
Representative Haddad,
Haddad votes yes.
Representative Hall,
Representative Hall votes yes.
Representative Harrison,
Representative Harrison votes no.
Representative Hoxa,
Representative Hoxa votes no.
Representative Johnson, Representative Johnson, Representative Khanna,
Representative Khanna votes yes.
Representative Kennedy,
Kennedy votes no.
Senator Kushner,
Yes.
Senator Lesser,
Senator Lesser, yes.
Senator Marks,
Senator Marks, yes.
Representative McCarty,
Representative McCarty votes no.
Senator McCrory, Representative Nolan, Representative Porter, Representative Osborne, Representative Reyes, Representative Rosario,
Rosario in the affirmative.
Representative Retigliano,
No.
Representative Ryan,
Yes.
Representative Sanchez,
Yes.
Senator Slapp,
Senator Slapp votes yes.
Representative Sims,
Sims in the affirmative.
Senator Summers,
Senator Summers votes no.
Representative Terciak,
Yes.
Senator Winfield, Representative Zawistowski.
Representative Reyes votes in the
Okay.
affirmative.
Wait a minute, Representative Reyes, hold on. Representative Felipe first, please.
Representative Felipe votes yes.
Thank you, sir. Now Representative Reyes, and please make sure you've turned your camera on.
Representative Reyes in the affirmative.
Thank you, sir. Madam Administrator, we all set? Yes, okay, great. Up next is the, I'm gonna call, number 13, House Bill number 617, an act promoting equity and coverage for fertility health care. JF to the floor. Is there a motion?
So moved.
Moved by Representative Sims. Is there a second?
Second.
Second, Representative Exum, discussion. Representative Nuccio.
Thank you, Madam Chair. I have some questions or concerns about this bill. If I could, maybe through you ask questions to the proponent of the bill.
I think I'll answer all the questions right now.
Okay. All right. I noticed that this bill in the first couple of sections here is heavy with insurance language. Again, this is another bill that we're talking about today that seems to have skipped the insurance committee as a whole, even though it's referencing insurance the entire first part of the bill. And I wanted to ask OFA from the fiscal perspective if we have accounted for this. I'm sorry, I'm a little discombobulated right now. I wasn't ready for this bill yet. I have my notes, but I wanted to ask OFA in regards to the fiscal note on this for the last section of the bill, which expands this to Medicaid.
Mr. Ayers.
Excuse me, the question?
Okay, I just want to make sure you're ready, sir. All right, so in section 3, this is expanding fertility treatment to the Medicaid state plan to provide fertility treatment coverage in accordance with section 1 and 2 of this act, which are referencing insurance legislation. And that for medically necessary and permissible under the federal law. Do we have any fiscal note on here that would account for the cost of the fertility treatment, and pursuantly, if the person is on Medicaid and we are paying for the fertility treatment, the child would be born on Medicaid and the child would potentially stay on Medicaid until the parents reach a portion, or the parent or parents reach a portion of income that would get them off of there. So we're looking at long-term dependent on another Medicaid insured. Do we have any kind of fiscal analysis that would show not only the cost of this very expanded Medicaid fertility treatment and the ongoing expense for the Medicaid insurance for the child going forward?
First, let me say what I probably should have said the first time you had me up here. What we provided today are preliminary fiscal amounts. We didn't have a lot of time on many of these bills. Many of these proposals will be fleshed out before these reach file copy. I can't speak to what our subject matter experts, how they will be modeling the details of this bill, but I think that certainly will be part of the conversation.
Representative Nuccio.
Well, I guess I'm concerned with that because this bill is not in the budget and I think this would have a pretty large fiscal note. So I don't really think it's kind of fair for us to be voting on whether or not we should pass this out of the Appropriations Committee without understanding the fiscal piece of it. So do we have, is any part of fertility treatment currently covered for Medicaid that you're aware of?
I don't believe so.
Does the state insurance plan cover for infertility treatment for their employees?
I'm hearing yes.
Yes, it does. So do we have numbers from that we could extrapolate an average cost for an infertility treatment?
As I said, our analysts will be looking at this for the file copy, which is part of the normal process. I can't say exactly how they'll model it, but something along what you're saying is how we would try to figure these out. As I said earlier, it's going to be population times utilization times service and cost for service. And I think there's probably a lot of factors in there that I don't think are necessarily defined in the bill. Our folks would be looking to model it, I assume, based on those lines.
Okay, and when do you think we would have that information?
When it reaches file copy for the floors of the chambers, that's part of the process.
Okay, unfortunately, my question around so the ACA currently, the federal ACA has essential health benefits that are the 10 essential health benefits. And the legislation currently says that if state mandates a new coverage that is above what is currently in essential health benefits, then the new section of the law would constitute a new state mandate, and the state of Connecticut would have to pay that not only for the state employees or for the Medicaid population, but for the insured population also. So anybody on Access CT and any other mandates that happens in the insurance industry could come back, and the state of Connecticut would have to pay that.
So I believe we identified as a potential cost. As not an expert in this area, I don't believe the state has been assessed on any costs in excess of the plan that you're speaking of for any of the insurance mandates that have passed. I don't. Federal government has yet to provide guidance to the Department of Insurance on those, so I don't think we've been assessed on anything.
Okay.
But there's certainly a potential under the ACA.
I'm being yelled at. Okay. Yes. So would this, I don't know if this is a question for you, sir, or not, but would this expansion service qualify for the 50% federal match that we currently receive from Medicaid, since it's an expansion beyond essential health benefits?
I don't believe those two policies are related. If it's an allowable expenditure under the federal Medicaid program, they would reimburse for it. That's separate from the ACA provisions.
Is this part of the federal Medicaid program? Because that would be contingent on us getting the 50% match, correct?
Correct.
So we'd have to, excuse me, I'm just going to step in. So we would have to apply to Medicaid to see if they would accept this before this would move on relative to that. Putting the bill in does not mean that that's the end of our process. So we would have to apply to Medicaid to see if they would cover that. That is my understanding.
I don't think the bill reads that way, though. That's my concern.
Well, this bill has to go many more places before it actually gets voted on, because it'll go to the floor of the House and they'll refer it to the respective other areas where it has to go. So this isn't its last stop. Just because we see something does not mean it's the last stop of a bill, so.
So that was my question in the beginning. If this
Yep.
will then go to insurance to
will.
be reviewed.
Well, that's up to the House, but the House has been very critical about about sending things to other areas. They don't tend to like to vote on something that gets criticized because it didn't go to a committee of cognizance, and so it'll go to the insurance committee and then go back to the floor. So it's got a number of trips to make before we ever make it there.
Okay. All right. Thank you very much.
Thank you. Representative Retigliano, 2 questions, sir.
No, just a comment, madam. If it's gonna get referred, why don't we just refer it now? Why
But
don't
we
we?
can't refer from here because it's beyond their deadline. That's the only reason. Seeing no other questions, Madam Administrator, if you could call the roll, please.
Senator Austin,
Senator Austin votes in the affirmative.
Representative Walker, Senator Hartley, Representative Exum,
Representative Exum votes yes.
Representative Paris,
Paris is yes.
Senator Berthel,
Senator Berthel is a no with a flag.
Representative Nuccio,
Representative Nuccio is a no also.
Senator Anwar,
Senator Anwar votes yes.
Representative Baker,
Representative Baker votes yes.
Representative Belinsky, Representative Callahan,
Representative Callahan, no.
Representative Candelaria,
Candelaria votes yes.
Representative Teleski,
Representative Shaleski is a no.
Representative Curry,
Yes.
Representative Dathan,
Representative Dathan is a yes.
Representative DiCaprio,
Caprio's a no.
Representative Delaney,
Representative Delaney votes yes.
Representative Delnicki,
No.
Representative Dillon,
Dillon, yes.
Representative Felipe.
Felipe votes yes.
One more time, please.
Felipe votes yes.
Thank you. Senator Flexer. Representative Foncello,
Representative Foncello votes no.
Representative Garabay,
Representative Garabay votes yes.
Representative Gibson,
Representative Gibson votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes no.
Representative Gonzalez,
Representative Gonzalez votes yes.
Representative Haddad,
Haddad votes yes.
Representative Hall,
Representative Hall votes yes.
Representative Harrison, Representative Harrison,
Representative Harrison votes no.
Representative Hoxa,
Representative Hoxa votes no.
Representative Johnson,
Representative Johnson votes yes.
Representative Khanna,
Representative Khanna votes yes.
Representative Kennedy,
Kennedy votes no to flag without a fiscal note.
Senator Kushner,
Yes.
Senator Lesser,
Yes.
Senator Marks,
Marks votes yes.
Representative McCarty,
Representative McCarty votes no.
Senator McCrory, Representative Nolan, Representative Porter, Representative Osborne,
Osborne votes yes.
Representative Reyes, Representative Rosario,
Rosario votes yes.
Representative Reyes votes in the affirmative.
I need your camera on, sir, please.
Representative Reyes, I can't take your vote without your camera on. All right, Representative Retigliano. Representative Ryan,
Representative Ryan votes yes.
Representative Sanchez,
Representative Sanchez votes yes.
Senator Slapp,
Senator Slapp votes yes.
Representative Sims,
Representative Sims in the affirmative.
Senator Summers. Representative Tercia,
Yes.
Senator Winfield. Representative Zaustowski. Representative Reyes, you want to try again?
Unfortunately, I can't turn the camera on. I'm not sure what's going on. I'll keep trying.
Okay.
Thank you.
Madam Chair, can I vote on this? Nolan?
Representative Nolan, we need your camera on in order to record your vote.
Nolan in the affirmative.
Thank you.
Are you all set, Madam Administrator? Up next, we're gonna do item number 15, House Bill substitute for House Bill number 6663, an act establishing the English Learners Bill of Rights. JF to the floor. I'll entertain a motion for this bill. Moved by Representative Sims, seconded by Representative Paris. Is there any discussion on this bill? Seeing no discussion, could you call the roll, please?
We were doing a little business here, so I missed that entirety. So who please made the motion and who's made?
Representative Sims made the motion. Representative Paris seconded that.
Thank you, Madam Chair.
Call the roll, please.
Yes, Senator Austin,
Senator Austin votes in the affirmative.
Representative Walker, Senator Hartley, Representative Exum,
Representative Exum votes yes.
Representative Paris,
Yes.
Senator Berthel,
Yes.
Representative Nuccio,
Hold on one second. I'm gonna vote no for now. Sorry.
Senator Anwar,
Senator Anwar votes yes.
Representative Baker, Representative Baker, Representative Belinsky, Representative.
No.
No. Representative Candelaria,
Candelaria votes yes.
Representative Chaleski,
Chaleski is a yes.
Representative Curry,
Yes.
Representative Dathan,
Dathan is a yes.
one more time for me, please.
Can you hear me, Madam Clerk?
I can't.
Representative
No.
Dathan is a yes.
I still can't see you, Representative.
Representative Dathan,
Dathan.
Representative Dathan is a yes.
Thank you, ma'am.
Just move on.
Representative DiCaprio,
Caprio's a no.
Representative Delaney,
Representative Delaney votes yes.
I don't think. Representative Del Nicky,
Yes.
Representative Dillon,
Yes.
Representative Felipe.
Representative Felipe votes yes.
I'm sorry, one more time for me.
Representative Felipe votes yes.
Thank you, sir. Senator Flexer. Representative Foncello,
Representative Foncello votes no.
Representative Garabay,
Garabay votes yes.
Representative Gibson,
Representative Gibson votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes yes.
Representative Gonzalez,
Representative Gonzalez vote yes.
Representative Haddad,
Haddad votes yes.
Representative Hall,
Representative Hall votes yes.
Representative Harrison,
Representative Harrison votes no.
Representative Hoxa,
Representative Hoxa votes no.
Representative Johnson. Representative Khanna,
Representative Johnson votes yes.
Representative Khanna.
Representative Khanna votes yes.
One more time for me, ma'am.
Khanna is a yes.
Thank you. Representative Kennedy,
Kennedy votes yes.
Senator Kushner,
Yes.
Senator Lesser. Senator Marks,
Senator Marks votes yes.
Representative McCarty,
Representative McCarty votes yes.
Senator McCrory,
Senator McCory is a yes.
Representative Nolan,
Representative Nolan in the affirmative.
Representative Porter, Representative Osborne, Representative Reyes, Representative Rosario,
Rosario is in the affirmative.
Representative Rutigliano, Representative Ryan,
Representative Ryan votes yes.
Representative Sanchez,
Representative Sanchez, yes.
Senator Slapp,
Senator Slapp votes yes.
Representative Sims,
Sims in the affirmative.
Senator Summers, Representative Terciak,
Yes.
Senator Winfield, Representative Zawistowski.
Madam Clerk, did you get Representative Dathan as a yes?
Madam Administrator certainly did.
Oh, thank you, Madam Administrator.
Madam Administrator, Representative Reyes in the affirmative.
Thank you, sir.
sir.
Thank you.
Madam Administrator? Okay, we're taking a short pause. I don't know whether we call it a recess, at least for a little bit. The Madam Administrator needs to make sure that everybody has voted. I ask all of you, if you have people that have not voted yet, to make sure that your colleagues are getting a text from you or a call to get them to vote. And I strongly suggest that people use the respective facilities if they so have to. I'll be
Alright,
back.
We are going in the order in which the votes were called. So the first item is item number 2, Senate Bill 10. The proposed motion is JF. Is Senator Hartley on? Representative Candelaria. Gotta stay with me, people. Representative Candelaria, this is the last time that I'm calling the roll on these bills. Representative DiCaprio.
DiCaprio's a no.
Representative Hall,
Yes.
I need to see you.
Yes.
Thank you, sir. Representative Nolan,
Nolan is in the affirmative.
thank you. Representative Reyes,
Representative Reyes in the affirmative.
I can't take your vote, sir, without being able to see you. I'm sorry.
I know I'm struggling with this phone. I'm not.
Okay. I'll try you again. Representative Sanchez,
Representative Sanchez, yes.
Senator Summers. And I see that Senator Hartley's on.
Yes, Madam Administrator. Are we on
Item number 2, ma'am, Senate Bill 10.
in the affirmative?
Hi, Representative Reyes, I saw you.
In the affirmative, please. Thank you. Thank you, Madam Chair.
Thank you, sir. Don't go anywhere. Don't shut anything off. Don't. Okay. Next bill is item number 1, House Bill 6902. Action is a JF. Senator Hartley. Senator Hartley.
Yes, in the affirmative.
Representative Belinsky. Representative Callahan. Representative Hall.
Yes. Representative Hall, yes.
Representative Nolan.
Representative Nolan in the affirmative.
Representative Reyes.
Representative Reyes in the affirmative.
Representative Retigliano. Representative Sanchez.
Rep. Sanchez, yes.
Senator Summers. Item number 3, Senate Bill 946, proposed action JF. Senator Hartley.
Madam Administrator,
Who's that?
Representative Delaney.
Oh, I'm sorry, you're right. I did not
The
have
last
the
two votes,
card
yes,
next
ma'am.
to you. Thank you for paying attention. Representative Delaney.
I'd like to have my vote cast in the affirmative, please, for both votes.
Thank you, sir.
And I think, oh, all right.
Nope, I gotta, yeah, nope. Okay. Item number 3, Senate Bill 946, the motion is a JF. Senator Hartley.
In the affirmative.
Representative Baker. Representative Belinsky. Representative Callahan.
Callahan, yes.
Representative Delaney.
Representative Delaney, yes.
Representative Hall.
Representative Hall, yes.
Representative Harrison. Representative Nolan.
Forgive me?
I can see you.
Nolan in the affirmative.
Thank you. Representative Reyes.
Representative Reyes in the affirmative.
Representative Sanchez.
Rep. Sanchez, yes.
Senator Summers. Item number 4, Senate Bill 977, motion is the JF. Senator Hartley.
In the affirmative.
Representative Belinsky. Representative Callahan.
No.
Candelaria, yes.
Representative Candelaria.
Candelaria, yes.
Thank you, sir. Representative Delaney.
Representative Delaney votes yes.
Representative Nolan.
Representative Nolan in the affirmative.
One more time. I didn't see you, sir. I'm sorry.
Representative Nolan in the affirmative.
No, I'm sorry. I'm not seeing you. All right. We'll try again, Representative Nolan.
All righty.
Representative Reyes.
Representative Reyes in the affirmative. Thank you.
Representative Sanchez.
Rep. Sanchez, yes.
Senator Summers. Keep this one out so we can call Nolan again. All right, item number 5, Senate Bill 978, motion is a JFS LCO 6916. Senator Hartley.
Senator Hartley in the affirmative.
Representative Belinsky. Representative Callahan.
Callahan, no.
Representative Delaney.
Representative Delaney votes yes.
Representative Hall.
Representative Hall votes yes.
Representative Nolan. Representative Reyes.
Nolan in the affirmative.
Up.
Nolan in the affirmative.
Representative Nolan.
Representative Nolan in the affirmative.
All right, and how would you like to vote on the previous one?
In the affirmative.
Thank you, sir. Representative Reyes,
Representative Reyes in the affirmative.
Representative Sanchez,
Rep. Sanchez, yes.
Senator Summers.
Use paper.
Item number 6, Senate Bill 1001. Motion is a JFS, LCO 6919. Senator Hartley.
Senator Hartley, yeah, in the negative.
Representative Belinsky. Representative Callahan.
Item number 6, no.
Representative Candelaria. Is he there? Representative Candelaria. Okay. Hold on. Representative Delaney,
Representative Delaney votes yes.
Representative Hall,
Representative Hall votes yes.
Representative Nolan,
Representative Nolan votes yes in the affirmative.
Representative Reyes,
Representative Reyes in the affirmative as well.
Senator Summers. Item number 8, Senate Bill 1109, JFS, LCO 6926, Senator Hartley.
Senator Hartley in the affirmative.
Representative Nuccio. Yeah. Item number 8, Senate Bill 1109. Take a peek and let me know.
Wait, Madam Administrator?
Representative Khanna,
Yeah, did we do item number 7 or are you waiting for that?
where's 7? Hold on. Oh, I'm sorry, got moved out of order. We're doing them in the order in which they were called.
Okay,
Madam Administrator.
Okay, I can't have everybody, those of you who are online, you cannot talk to me. I'll talk to you. You don't talk to me because I got stuff going on in this room. Representative Nuccio. Thank you, ma'am. Okay. Where am I? Representative Belinsky, Representative Callahan. We're on 8. Okay, Representative Candelaria. Representative Delaney,
Representative Delaney votes yes.
Representative Hall,
Representative Hall votes yes.
Representative Nolan,
Representative Nolan in the affirmative.
one more time. Oh, yay, saw you. Okay. Senator Summers. Okay. Representative Baker, what can I do for you? Representative Baker. Has he missed anything? Can you check those and see if he's missed anything yet? All right, we're gonna move on to item number 9, Senate Bill 1199. Okay. Senator Hartley. Senator Hartley.
In the affirmative.
Representative Belinsky, Representative Callahan,
Yes.
Representative Candelaria. Senator McCrory. Representative Nolan,
Senator McCoy,
I'm sorry, Senator McCrory is a yes.
Representative Nolan,
Nolan in the affirmative.
wherever you are, stay there, Representative Nolan, because we're seeing you. Representative Sims,
Representative Sims in the affirmative.
Senator Summers. All right, I'm going back to item number 3. Representative Baker, are you there?
I am.
Great. How would you like to vote, sir?
Representative Baker votes yes.
Thank you, sir. Okay, moving to item number 7. Senate Bill 1096, motion is a JF. Senator Hartley.
Madam Administrator, in the affirmative.
Representative Belinsky. Representative Callahan.
Yes.
Representative Candelaria. Representative Hall.
Representative Hall, no.
Representative Khanna.
Hannah is a no.
Representative Nolan. Representative Nolan. Okay. I'm gonna go to Representative Reyes. Representative Reyes,
Representative Reyes passes on this one right now.
well, sir, this is it, because votes are being closed after this, so I'm gonna finish the tallies, and then I'm gonna come back to you on this, and that's it.
Thank you. Thank you, Madam
Got
Chair.
it? Okay, hold on this one, please. Okay, item number 12, 6616.
Madam Administrator, could I vote no on the previous item?
I'm sorry, Representative Dillon, I'm having a hard time hearing you.
I'd like to vote no on 1096.
109, okay. I got you.
Thank you.
You're welcome. All right, this looks good. This one's good now, right? 3, I don't have to worry about 3 anymore because I got Baker. Okay, item number 12, 6616, JFS LCO 6932, Senator Hartley.
Does this expand it to 18? Age 18?
Somebody please answer, could somebody please answer Senator Hartley's question, because it's not appropriate for me to do so.
I'll pass and I'll find it out.
And Senator Hartley's going to 15.
It's going to 15.
Yes, ma'am.
Okay, all right. So Senator Hartley in the affirmative.
Thank you, ma'am. Representative Belinsky, Representative Callahan, Representative Candelaria, Senator Gordon, Representative Johnson, Senator McCrory, Representative Nolan,
Senator McCrory is a yay. I'm sorry, Senator McCrory is a yes.
thank you, Senator McCrory. That's a yes, correct, sir?
Yes,
Thank you, sir.
yes, that's a yes.
Thank you, sir. Representative Nolan,
Representative
Nolan,
Representative Nolan in the affirmative.
thank you, sir.
Representative Johnson votes yes.
Representative Osborne,
Representative Osborne votes yes.
Did you want to go out?
Senator Winfield,
You're so cute. You can go out.
item number 13, House Bill 6617, motion is a JF. Senator Hartley,
Madam Administrator, could I pass for a minute, please?
Sure,
Thank you.
you're welcome. Oh, Jesus, now I gotta go. Belinsky, Representative Belinsky. Senator McCrory. Who?
McCory's a yes.
Thank you, sir. Representative Porter, Representative Reyes,
Representative Reyes in the affirmative.
Senator Summers, Representative Zawistowski, Senator Hartley, do you still need a moment?
Yeah, Senator Hartley in the negative right now.
Okay, thank you, ma'am. All right, and lastly, item number 15, House Bill 6663. I don't even know what the motion was. Senator Hartley.
I'm gonna pass for a minute here, Madam.
Okay. Representative Baker,
Representative Baker votes yes.
Representative Belinsky, Senator Flexer,
Very briefly.
hi, Senator Flexer. I can't see you.
Senator Flexer votes yes.
Ah, perfect. Thank you, ma'am.
Thank you.
Okay, Osborne, yes. Thank you, ma'am. Hold on. Representative Retigliano. Senator Summers. Senator Hartley, are you ready?
Madam Administrator, I'm gonna pass on this, please.
All right, do you want to abstain, ma'am?
Yeah.
Okay. Got it. All right. I am done. If you're on and you need to vote, now's the time to holler.
Madam Chair, Rep. Nolan is wondering about Bill 1096. Did I vote on that?
Okay. Okay. How would you like to vote on that one, sir?
Affirmative, please.
Thank you, sir.
Madam Clerk, on the same bill, 1096, Representative Reyes in the affirmative as well.
The one they're talking about. I don't think so. I got this. Anybody else? Is Nolan good?
Nolan's good.
I don't think you did. Just would have apologized.
I went through everything.
All right.
She got pants online.
Who's online? All right. Representative Delaney, what can I do for you?
Hello, Madam Administrator. I just wanted to check to make sure that I'm not being recorded as missed any votes.
You need to vote on item number 2, Senate Bill 10.
I'd like my vote cast in the affirmative, please.
Thank you, sir. Stay with me so I double check.
Yes, ma'am.
Representative Delaney, you're good. Next one in the queue is Representative Gilchrist.
Hi, Madam Administrator, just making sure I didn't miss any votes.
And while I'm checking, I just want to remind you all that the meeting is not over. So as we do the next bills, the tally is going to be called. So you better all stay online. Representative Gilchrist, you are fine.
Thank you so much.
You are welcome. Representative Baker,
I'm fine.
let me double check that you're fine, sir.
Okay, you change. Put on
Looking
one
right
old.
now. Give me 2
Thank you.
seconds. Representative Baker, you're good. Senator Gordon, I know we need to get you on a bill or two, at least one.
Yes, I think I did miss one, Madam Administrator.
I'm getting there, sir. Yep. Item number 12, House Bill 6616.
Senator Gordon votes no.
Okay, let me double check, make sure I've got you recorded for everything else. You are good. Thank you, Senator Gordon.
Thank you.
Okay, Representative Paul,
Checking in.
I'm gonna double check. Hold on, make sure I got you on everything. You're good.
Thank you.
Representative Reyes.
Madam Administrator, I just want to make sure that I'm current, please.
Okay, I'm going through you, the votes right now. You are good. Thank you, sir.
Thank you, Madam.
Representative Candelaria, you got a few you got to catch up on, my friend.
All right, I'm ready, Madam Administrator.
Okay.
Yes.
First one is item number 1, House Bill 6902.
In the affirmative.
Item number 2, Senate Bill 10.
Senate Bill 10 in the affirmative.
Item number 5, 978.
In the affirmative.
Item number 6, 1001.
In the affirmative.
Item number 12, House Bill 6616.
In the affirmative as well.
Item number 3, Senate Bill 946.
In the affirmative.
Item number 9, Senate Bill 1199.
Affirmative.
Item number 8, Senate Bill 1109.
The affirmative.
Item number 15, I have you on. The last one is item number 7, Senate Bill 1096.
Affirmative.
Thank you, sir. You're all set.
Thank you, Madam.
Next in the queue is Representative Gibson. I'm gonna check, sir.
Okay, thank you.
You're all set. Thank you, sir.
Thank you, Susan.
Senator Hartley?
Uh, Madam Administrator, on item 6617, I'd like to be recorded in the affirmative, please.
6617 in the affirmative. Gotcha. Okay, anything else, Senator Hartley?
No, what was the one that I abstained on, Madam Administrator?
Yep, I'm getting to that one. Item number 15, House Bill 6663.
Okay, that was new on today's agenda, right? Yeah, in the affirmative.
Okay, great. Okay, and I think you're good after that, right?
I believe so.
Thank you, ma'am.
Thank you.
Okay, Representative Garabay.
Just checking.
Okay. You are all set, ma'am.
Thank you.
Representative Khanna.
Same, just checking.
Okay. You are all set, ma'am.
Thank you, Madam Administrator.
You're welcome. Representative Nolan, I will double check, make sure we got everything for you.
Thank you, ma'am.
You're all set, sir.
Thank you for all you do. Have a nice weekend.
All righty. And with that, I bid you all a fond farewell.
Thank you, Madam Administrator. Great job.
Thank you very much.
Thank you.
Thank you.
Thank you. Have a good weekend.
Thank you,
Please,
Madam
everyone-
Administrator.
No,
Please stand by.
don't go anywhere. We have not adjourned. We are not in, we're just in a recess for people to catch up. There's still items on the agenda.
Madam Chair, did we finish?
I'm gonna say one more time, kids, for those of you who are online, stay online. We ain't done. We have more, the chairs are about to reconvene the meeting and we have more items to take up before 5 o'clock.
Good afternoon, everybody. I'm going to reconvene the meeting and we're going to go into an immediate caucus. The the Democrats will be caucusing in 2600 and the Republicans will be caucusing in 2A. The Democratic caucus will be in 2D. 2600 is already being used.
Will we get a Zoom link?
Yes, you'll be sent a Zoom link.
Qué rápido fue eso. 2 seconds. Esto aquí, lo más fácil que hay. Beautiful. 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. Make request.
Minnie, your computer is unmuted.
Okay. Hello?
Rep Gonzalez, your computer is unmuted.
Okay, we're gonna mute it now. Thank you. Okay.
that will be done. And I just go there and make sure I'm on mute.
So we're going to call the meeting back to order, but we are not doing any more business. We're going to adjourn the meeting right now. Want to appreciate everybody for all the work that they did, but the meeting is now adjourned. Chris, let them know.